Yeah, if you need to pick up anything or discuss with your staff, you still have like 2 minutes. We'll start. Settle in, please. Welcome everyone to the hearing of our subcommittee of the Committee on Finance. I'd like to greet all our resource persons, starting with Secretary of Health, Dr. Secretary Ted Herbosa, PhilHealth President and CEO Emmanuel Ledesma, our National Nutrition Council Executive Director Azucena Dayanghirang, PITAC Director General Maria Teresa Coinigo, Philippine National AIDS Council Executive Director Joselito Feliciano, Lung Center of the Philippines Executive Director Vincent Balanag Jr. Hello. Philippine Children's Medical Center Executive Director Sonia Gonzalez. National Kidney and Transplant Institute Executive Director Rose Marie Liquete. And Philippine Heart Center Executive Director Avelino Aventura. So on our agenda today is a proposed budget under the fiscal year 2025 of the National Expenditure Program of the DOH and its attached agencies and corporations. So for DOH, Office of the Secretary, we have new appropriations of 217,388,398,000 pesos. For National Nutrition Council, our total is 313,093,000 pesos. Philippine National AIDS Council, total appropriation of 50,284,000 pesos. Lung Center of the Philippines, 711,335,000 pesos. For National Kidney and Transplant Institute, 1,486,886,000 pesos. For Philippine Children's Medical Center, 1,397,216,000 pesos. For Philippine Heart Center, 2,212,920,000 pesos. For Philippine Institute for Traditional and Alternative Healthcare, 154,726,000 pesos. And for the Philippine Health Insurance Corporation, 74,431,930,000 pesos. So before we start the presentations, I'll just make a short statement since my colleagues are not here yet. So I want to tie this into the SDGs, the Sustainable Development Goals. SDG 3 is on good health and well-being, seeks to ensure healthy lives and promote well-being for all ages. And then I tie this into the WH statement that is health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I'd like us to be mindful that I know I chaired the Committee on Health in 2004 for 9 years, since 2004. And then I've chaired this budget of the Department of Health and attached agencies for 5 years. So although I don't have any professional degree in any medical field, I have done the research. I have talked to a lot of you, the experts. And I do believe that there's more that we can do, not just in the budgetary process, but in the area of information campaign, and also in the area of promoting well-being, health and well-being. I think we can actually move away from the urgent and immediate solutions, because we are not in the same place we were when I first became chairman in 2004, that medyo may economic crisis tayo, kulang na kulang yung budget. Because of the laws that we have passed, billions of pesos are now available to healthcare. They're available to the health agencies and to the infrastructure programs, to the health professionals. So hindi na pwede yung program natin are just yung immediate stopgap interventions. Kumbaga sa natural calamity, hindi na pwede yung biglang last minute nagsisave lang tayo ng lives, no? This is already parang kumbaga nga in that field, it's disaster risk management and prevention. So I'd really like to hear what your interventions are, because they are embedded in your programs, but really on promoting healthy lifestyle, because we all know, and I've said this since day one, I'm not the health professional, I'm the legislator, and now I'm the person in charge of your budget. But what are we doing enough? Are we doing enough to help more people enter their senior years in a healthy state of mind and body? Hindi yung nadadagdagan lang yung yung dialysis, nadadagdagan yung budget pang maintenance medicines. That's not really, and then ang increase ng budget for wheelchairs. Hindi yun ang importante yun. Don't get me wrong. Importante yun. And I know I'm preaching to the choir, right? But I'd like to empower you to think beyond that. I know, lahat tayo. Pipilahan din naman ako eh. Pipilahan din ako, lahat ng mga senators at ng mayors, governors, pipilahan kami for assistant pambili ng gamot, assistance pang na stroke, pambili ng wheelchair, financial assistance para magpa-therapy. Pero yung tanong ko, ano ba yung enough ba yung ginagawa natin so that while they are kids, while they're teenagers, while they are young people, you're educating them so that they enter their senior years in the prime of health. And that is very possible. With the digital age that we live in, and bahala na kayo, kanya-kanya na kayo, but I can give you my phone. I can pass it around. And if you look at my Instagram, yung pumapasok na feed sa akin is all about healthy living, nutrition, mga 90 years old na sumasali ng mga marathon, because yun yung interest ko. So, ganun din sana yung pinopromote ko na interest ng mga kababayan natin, di ba? Wala namang problema kung mahilig ka sa makeup, mahilig ka mag-shopping, pero sana tulungan natin sila to make health sexy for them, to make health something that they look forward to make being healthy an amazing lifestyle, something you want to do after work instead of going out for a drink. So anyway, as I said, I'm preaching to the choir, but I'm trying to inspire all of you to help. So with every intervention you make on the operating table, with your budget officers, do the same sana effort and time to really see what kind of promotional campaigns you can do to really change the way we look at not just aging, but living a healthy life. And I'll end with this, no? And I'm sure you already know this. You look at the Nordic countries, that's how they raise their kids. Yung mga bata pa lang nagtatatakbo. Yung mga bata pa lang pinapakain, ang pagkain nila is prutas, sufficient amount of protein. Hindi yung sa atin, paglabas mo, nagbebenta ng, I don't know how much yun ngayon, 5 pesos or whatever, na puro asukal at food coloring. Yun yung snack ng mga bata. But if you go back to the earlier days where ang pagkain nila is saging na saba, okay naman, 'di ba? Pero mapapalitan niya ng napakaraming processed food. So really, I'd like to focus on that, not necessarily today's hearing, but in the future budgets and in the time and energy you all spend. Because there's enough data to tell us that when you live this kind of life, you'll have less, you'll need to put less. We can use the budget. Yung health budget yung nga, if you ask me, dapat kayo din nagpapatayo ng track oval. Not necessarily track oval, walking paths. Kayo dapat nagpapatayo niyan. Hindi nyo dapat inaasa lang yan sa Philippine sports. I'm not asking that all people become marathoners, but they should become walkers. You should be pushing for the budget of sa init sa Pilipinas, sige, walking path but also shaded walkways, 'di ba? Para mas ganahan naman sila maglakad. Anyway, so that's my little piece, and I hope to say less. I will give the floor to all of you in a few minutes. So just a few issues that I want to ensure that you clarify when I give you the floor. For DOH, let's clarify the budget for health emergency allowance, because I was of the impression, and so was my whole team, that the amounts that we were allocating over the last few years were already the total amount is the total amount needed for the HEA. And then now we're told that there's another 4.7 billion being requested as of the moment. Tapos madadagdagan pa. May deadline naman to. We can't naman be forever processing these requirements, no? Medyo nakakagulat lang to. So kindly clarify this. And then I need an explanation on the low utilization rates for our health facility enhancement programs and other major programs. This is a perennial problem with DOH. I'd like also an update on infant immunization programs and the hiring of vaccinators. Where are we now? I know we've made some progress, but I'd like to get more details. And then the healthcare workers gap. In the previous hearings that I chaired, I already had a hearing with on the budget of the Department of Education and the Commission on Higher Education and the state universities and colleges. And I take pride in telling them that I'm in a unique position to help those two education um, agencies tie up with the Department of Health and your health needs, because hindi naman kayo miraculously makakaproduce nung shortage natin of health workers in certain fields, like whether it's the doctors, physical therapists, what do you call it? Radiologists, anyway, and so on and so forth. We won't be able to fill those gaps if you're not working very closely with SHED on enhancing or increasing the program offerings to the students. It's not going to happen overnight. So I don't know how much coordination is happening. So I expect a report on that as well. Okay. And then for PhilHealth, as you all know, the Senate has had hearings on the issue of the transfer of PhilHealth funds to the Bureau of Treasury. And this is very relevant to the budget because for the last 5 years, as I said, humihingi sa akin most of the years except yata last year, except only for last year. PhilHealth has been asking for additional budget and then suddenly namigay ng pera. So I understand that hearings have been held, but in this forum, the budget, you need to explain to me what has happened in the last few years and now why suddenly after every year asking for additional budget, biglang, ay hindi pala namin kailangan. Ito na, binibigyan niyo na yung pera para sa ibang paggagamitan ng gobyerno. I want to understand that because I've been the recipient of all the requests and then suddenly hindi na nagre-request, namimigay pa ng pera. So I want to understand that better. Also for PhilHealth, I think there's just a need to clarify the principle of universal health coverage for all, because something in your presentations refers to an increase in coverage. What does that mean? Because technically we are covering every Filipino, so just clarify that later on. And then talk about the benefits package. It's very important for people to know the increase in the improvement in the benefit packages, and then also the increase in the case rates. And finally, sana may good news kayo sa konsulta kasi ilang taon na ako nag-aantay ng rollout nito. Ilang taon na rin ako nasasabihan na it's in the, ano tawag doon? At first, the program was still being prepared, and then for how many years? It's in the pilot stage. So I'm waiting for that to happen. And you all know, I don't need to tell you, you all know that that is an integral component of basic healthcare, preventive healthcare, that consulta package. Okay, so we'll start with Secretary Herbosa. You have about 10 minutes, and then PhilHealth will also have 10 minutes. And then by that time, I'm assuming my other colleagues will be here and they will be able to propound their questions after that. So I'm assuming the staff of the other senators who are attending are already present. Kindly inform your principal that if they arrive in the middle of the presentation, I'd like the presentations to be presented without our asking questions yet, and then I'll give the floor after the presentations. Anyway, there are just two major presentations. And 10 minutes will be allotted to the senators, and then we can do a second round if that's not enough. Okay. Administrative reminders. In this hearing, supposedly in the entire Senate, we practice sustainability. So we have pages going around. If you need water, you'll also be given food. But we don't use PET bottles, and we discourage that you have PET bottles. Kindly, I hope in our notices, we remind our resource persons to bring their own reusable containers, but we have glasses and you'll be given water. Anytime you need to stand up, you want to stretch your legs, you're more than welcome, as long as you're not the one speaking. If you're speaking, then that's the only time I require that you're seated. If you want to stand while you're speaking, that's also fine. But otherwise, you're welcome to stand up, stretch, go to the restroom. You don't need my permission for that. Okay, so we are ready to start. Secretary, you have the floor.
Thank you. Good morning, Madam Chair, and thank you for that opening statement. Indeed, I am aligned with trying to convert illness to wellness, and that's reflected in how we're implementing our budget. To the rest of all the officials and staff of the Department of Health and the attached agencies, I'd like to present today's budget hearing, the National Expenditure Program for 2025. To realize the vision that Filipinos are among the healthiest people in Asia by 2040, the health sector aims to enhance the overall health status of the population, strengthen infrastructure, capacity, and resilience of the health system to proactively anticipate and respond to health needs and crises. Additionally, the sector aims to ensure Filipinos have comprehensive access to culturally sensitive and gender responsive health services at primary, secondary, and tertiary levels. To achieve these objectives, the Department of Health will advance the 8-point action agenda sa Bagong Pilipinas, Bawat Buhay Mahalaga. Our efforts focus on primary care, including vaccination, nutrition, maternal health, water, sanitation, and hygiene, as well as the prevention and management of tuberculosis, road injuries, non-communicable diseases such as hypertension, diabetes, and cancer. Additionally, as cross-cutting measure, we are committed to expanding our investments in the digitalization of health services to enhance accessibility and efficiency. Before we proceed with the 2025 NEP budget, allow me first to present what the department has accomplished. In 2023, the Health Facilities Enhancement Program completed a total of 1,531 projects funded by the 2023 GAA. Of this, 473 are health infrastructures, 979 are medical equipment, and 79 are motor vehicles, including ambulances. In addition to the dedicated health workforce stationed at the Department of Health offices, hospitals, and facilities, we have deployed over 21,000 human resources for health through the National Health Workforce Support System. These professionals are serving in various regions of the country, especially targeting areas where there is a significant shortage of healthcare personnel. In addition, we have supported over 250,000 barangay health workers through capacity building activities, logistics, and performance-based incentives. As of October 4, 2024, we have already disbursed a total of 91.7 billion pesos to cover 15.5 million health emergency allowance claims from 2021 to 2023. Additionally, we have disbursed 3.1 billion pesos to cover over 170,000 claims for COVID-19 sickness and death compensation. Ma'am, the initial tranche of the 89.9 from PhilHealth, 27 billion, was also added to the health emergency allowance. In terms of our public health programs, we have achieved the following in the past year. We have fully immunized 62.3% of eligible Filipino children. We have achieved 58.1% demand satisfied with modern family planning methods and reduced the prevalence of stunting from 27.5% to 26.7%. Additionally, 88% of households now have access to safe, potable drinking water. Additionally, we have achieved 575,000 TB case notifications, signifying an improvement in our detection capacities. We also have assessed 20.5% of patients using the PhilPen protocol for the integrated management of hypertension and diabetes. Furthermore, we have served more than 22,000 patients across 34 cancer access sites and established 15 trauma centers for road injuries in the past year. In 2023, we successfully delivered medical assistance to nearly 4.5 million Filipinos. As of August 31, 2024, we have already supported approximately 2.6 million indigent and financially incapacitated patients. In addition, let me share some of the latest successes of the department. I am particularly proud of the successful response in the recent measles and pertussis outbreaks, which were a crisis in the early part of the year. Furthermore, I am pleased to announce that the Philippines has now exited the list of top 20 countries with the highest number of zero-dose children, a milestone in our efforts to improve our immunization coverage. We have also launched 33 Bagong Urgent Care and Ambulatory Service Centers. This is the Bukas Centers, a pioneering initiative designed to meet primary healthcare needs of our most vulnerable populations. These centers are set to provide accessible, high-quality care, effectively addressing critical gaps in our nation's healthcare system. The department has also taken the lead in several international initiatives and commitments focused on promoting equitable health wealth workforce, including South-South cooperation and the Philippine Pacific Partnership Program and bilateral labor agreements. Additionally, we have championed patient safety, leadership in addressing tuberculosis, health financing for non-communicable diseases and mental health, and efforts to combat climate change. We are also excited to share that there are already 7 ongoing legacy projects across multiple hospitals. Additionally, under the initiative of the President and the First Lady, 82 of 83 Bagong Pilipinas mobile primary care clinics have been successfully handed over to various provincial local government units. The remaining unit will be handed over to the Sulu provincial government once documentary requirements are completed. In terms of financial performance, as shown in this trend, the average 5-year budget utilization by obligation is 90%, while the average utilization by disbursement is 78%. These rates represent an improvement as compared to previous years, indicating a better budget management execution. As of August 31, the obligation rate of DOH OSEC for its current and CONAP budget is at 62%, and with a disbursement rate of 71%. Now let me present to you the highlights of the 2025 National Expenditure Program of the Department of Health. The Department of Health's substantial budget growth over the years signifies the government's commitment to strengthening the health sector, infrastructure, capacity, and services, aligning with the vision of improving overall health status of Filipinos by 2040. In this graph, the blue line represents the GAA, while the green line represents the NEP. In 2025, the DOH-wide budget based on the NEP is 300 billion, 4 billion pesos. The majority, or 73.4% of the DOH-wide NEP budget, is allocated to the DOH, amounting to 222.8 billion pesos. The remaining 26.5% of the DOH-wide budget is allocated to the DOH attached agencies or corporations, of which 74.4 billion pesos goes to PhilHealth. Of this amount, 53.1 billion pesos is for the premium subsidies for the indirect contributors, and 21.2 billion pesos is for benefit package improvements. The remaining 0.1% goes to the other attached agencies. Overall, the 2025 NEP for the DOH is in its attached agencies and corporations shows an increase compared to the 2024 NEP. Within the DOH, significant budget increases are allocated to, number 1, the operations of DOH hospitals and health facilities across Metro Manila and various regions. Number 2, the medical assistance to indigent and financially incapacitated patients. And number 3, nationally procured commodities related to family health, immunization, nutrition, and responsible parenting. Ma'am, sinama na namin sa 2025 budget yung HPB for all 9-year-old Filipina girls. So we have increased the budget to 7 billion. Now we proceed with the details of the DOH budget amounting to 222.8 billion pesos. This significant allocation will fund key initiatives of the 8-point action agenda and universal healthcare, driving critical improvements in our healthcare system. A substantial 94.8 billion will be dedicated to enhancing operations of the Department of Health hospitals and other health facilities in Metro Manila and all regions. This investment is crucial in improving healthcare services, ensuring better access, elevating the quality of care for all Filipinos. Meanwhile, 26.9 billion pesos will be allocated to provide the medical assistance to approximately 1.9 million indigent and financially incapacitated patients. Next slide, please. Ensuring to those that need most will be protected from catastrophic illness and expenditure. The National Expenditure Program also allocates 23 billion pesos for the Health Facilities Enhancement Program. This funding will support the construction, completion, and equipping of 688 rural health units, 7 polyclinics, 230 LGU hospitals, and 67 DOH hospitals, including 28 Bukas centers, 6 blood service facilities, 3 quarantine facilities, 7 military hospitals, and 80 other DOH facilities. Additionally, it will facilitate the procurement of 299 medical transport units, significantly enhancing the healthcare infrastructure across the country. Furthermore, the DOH will continue to deploy human resources for health through the National Health Workforce Support System with a NEP budget of 18 billion. This will cover the salaries of 21,722 healthcare professionals, ensuring that local governments and communities nationwide have access to medical care they need. The DOH will also expand the implementation of programs in family health, immunization, nutrition, and responsible parenting. This budget of 10.2 billion pesos will be used to procure routine vaccines and eligible population commodities for both nutrition and also oral health. The DOH remains steadfast in its efforts to prevent and control communicable diseases. With a NEP budget of 5.1 billion pesos, the department will continue to provide vital commodities for treatment and prevention of TB, HIV, and the other communicable diseases. The DOH will also strengthen and expand its capacity building, technical assistance, monitoring, and research for disease prevention and control with a NEP budget of 4.5 billion pesos. The Department of Health also will strengthen and expand programs against non-communicable diseases with a 3.5 billion peso budget from the NEP, which will be used to purchase commodities for hypertension, diabetes, cancer, and mental health. To enhance and accelerate the healthcare services, the 2.9 billion peso budget for the health information technology will be used to implement the DOH Information Systems Strategic Plan. The DOH will continue to protect the health and well-being of citizens through various health promotion programs with a NEP budget of 1.9 billion pesos. Ma'am, dito yung sinasabi niyong wellness programs. The tracks and everything can be budgeted to this. The DOH will expand the implementation of healthy settings program and health promotion activities in the regions. As I conclude this presentation, it is clear that the Department of Health is resolute in our commitment to ensuring a healthier future for all Filipinos through strategic investments, robust programs, and unwavering dedication. We aim to enhance health outcomes, strengthen our health systems, and guarantee comprehensive care access at every level. Your continued support and cooperation are essential in our journey to a bagong Pilipinas kung saan bawat buhay mahalaga. That ends my presentation. Thank you, Madam Chair.
I'll ask for a few clarifications since our colleagues are not yet here, no? So I'll break my own rule because our colleagues are not here. I know a lot of them have questions, PhilHealth, so it's in my best interest to delay it a little bit so that they hear your presentation. So just a few minutes so that we can also dispose of my questions. So the Philippines is no longer in the 20 no dose, no? So where are we? What category are we now in? Is there what? Yeah, we're no longer there.
We're no longer in the top 20. We still have a lot of zero-dose children. So yesterday we
Correct.
launched.
That's what I mean. I want to clarify that
Yeah.
because I'm not going to rain on our parade that we're not in the top 20, but let's be candid about where we still are. We still have problems, right? We still have
Yes.
problems. Okay. So that's what I want to address. Now I want to address now who's in charge of your health promotions.
Health promotion is a new director, Director Tina Marasigan.
Is she here?
Is she
Okay.
here?
Sige. So just listen. It's okay.
She's
You
in
don't
the
have to come
holding room.
forward or
We'll call her
be
here.
prepared. Be prepared. Anyway, so this is what I want to highlight. Everyone's on their phone, okay? Whether it's young people, old people, everyone is checking their phone. It's an addiction to look at your phone. So you might as well capture your audience if they're always looking at their phone. So you might be printing and be ready to show me the budget. You might be printing these 2-color or sabihin mo ng full color posters, posting it in the health centers. It changes every month depending if this is heart month, if this is lung month, whatever the month is, right? Of course you do that. But or even vaccination, maybe that's a daily thing, maybe that's a forever poster there in the health centers. But talk to any advertiser and people will see what they want to see. They can see that poster 10 times and doesn't sink in because it doesn't attract them. So go to what attracts them. Go to TikTok, have a good speaker, male, female, I don't care, but like have a doctor be speaking there about addressing the moms. Show visuals, and I'm gonna tie this into my other concern. A few years ago, in 2019, it was announced that there was a polio outbreak, and I also wanted an update on that. Like, was that stopped? Because I went around talking about it, telling young mothers that they no longer know what polio looks like, and I would show them pictures. And you need to do that because even in countries far developed than us, that's their problem. People forget. It's human nature. What happened 50 years ago is long gone. Di nila naalala yan. So they forget that measles can kill, right? They forget because wala naman silang naririnig masyado in their lifetime. So we're talking about mothers in their 30s. Eh baka wala naman silang naalalang kaibigan, kaklase, kapitbahay nilang namatay ng measles. So when they hear these reports na, ay, huwag kayong magpabakuna, delikado yung bakunang yan, ay, saan mapapabakuna? They don't remember that measles kills. And with polio, which is very graphic yung photos, if you look at how polio devastated thousands of lives, or I don't know how many, a generation ago or 2 generations ago, the young people don't know about that. So that's my point, Secretary. I want your team to be aware that it's not that hard. It's not that hard to communicate properly, but you have to be creative and you have to know what makes what resonates with the people that you're trying to address, right? And then for the senior citizens, it breaks my heart. It has been breaking my heart when I was even hindi naman siguro 30s, when I was in my 40s and I'd meet people and say, hindi, matanda na ako, hindi ako maglalakad, sasakay ako ng kotse. 40, hindi naman pwede maglakad. Saan ka na naman nakarinig ng ganun? But a lot of people think that way. So how do you change that? How do you break these habits and tell them, that's why in my own little way, I tell you, feel free to stand up, feel free to stretch. On my way here, the study that I was seeing, and on Instagram, it's very easy. I can close my eyes, I can just listen to it, is that there's a study that says that walking before or after you eat reduces your glucose spike. But do we talk about it? Have we produced our own, to tell them that, maglakad kayo, di ba? Yung mga, I mean, I know those who are already in the diabetes care programs in the different localities, they know that na. Eh, paano yung wala pa doon? Hindi naman yun eh. Oh, and then alternatively, apparently there's a study that says even if you walk 2 minutes 10 times a day, so meaning to say, kahit na empleyado ka, 8-hour job ka, di pumunta ka sa CR ng 5 beses, tapos bago ka pumasok, naglakad ka naman siguro from your house to the jeepney stop or whatever, you can accumulate those minutes na gumagalaw-galaw ka at makakatulong yon sa general health mo. Yung mga ganun ba? Kasi I don't think the average person has that in their algorithms. I do, because it's my passion, it's my interest. Pero baka nga doktor din, wala din sa ganun dahil iba siguro yung buhay nyo na yun eh. So siguro yung libangan nyo, iba na, hindi na yun. But these are things that we can help the community and the patients with. So that's why I bring it back to that. Na where are we? Yes, I'm glad wala na tayo sa top 20 na zero. Pero ang dami pa rin zero. O paano natin nako-convince yung mga nanay? Paano? So you have to do that through ways that if it's a scare tactic, then you have to scare them with the truth. With the truth. Na pwedeng mamatay yung anak mo. Oh, show them pictures of a mother who lost a child. I lost a child. And I share that pain because I don't want any other mother to go through that. Tell them that story. Hindi nakikinig sila sa kani-kaninong influencer. So, yun. So what I'd like you to do is later on, if if to move along, tell me what you're doing about it, or submit a report. But it's got to be exciting. It's got to be something that the average person or the average mother, so kung mothers yung target natin because they're the health decision makers in the family, right? Then target the mothers. And then for these maybe, I don't know, 12-year-old kids, what can you make interesting for them so that they get excited about, a future. They become this young person that's an advocate for healthy living. It's cool to be healthy. It's cool to be the fastest runner versus the kid who's holding a vape, who's holding an e-cig. No, it's cooler that you're in that you're in the basketball team, the volleyball team, than nandun ka sa kanto at nagve-vape ka. You can create that. And I'm sure there's so many agencies that would like to work with you on that. Okay?
Madam Chair, my director for the Health Promotion Bureau is a new one. I've been trying to recruit her since the start of my term. Finally, her paper came out last month, and she started last Monday, September 30. She helped me launch the Bakuna Escuela and the big catch-up for vaccination yesterday. And maybe I'll ask her to talk a little bit about her plans for health
Sige,
promotion.
very
Director
briefly.
Tina Marasigan, please.
Good morning, ma'am. Yesterday, we launched the school-based immunization, particularly in 4 sites in the Philippines. So specifically here in NCR, Metro Manila, 1 in Tacloban, 1 in Cotabato, and 1 in Davao. So we are targeting grade 1, grade 4, and grade 7 students to receive specific vaccines for measles, rubella, diphtheria, and tetanus, and also for human papillomavirus or HPV vaccines for the prevention of cervical cancer. So this is one of the priority campaigns of the DOH because we are battling vaccine hesitancy. Gusto po naming paratingin sa kamalayan ng ating mga kababayan na yung ating mga bakuna po ay ligtas at epektibo at kailangan po natin ito para po maprotektahan yung ating mga kabataan. Because as we go back to the words of Secretary Herbosa, mas importante po na mai-highlight po natin ang prevention rather than treatment. Of course, we will go to the grassroots po para po mapaigting ang kamalayang ito. Actually, ma'am, we are working with the Department of Education as well, hand in hand, because prior the execution of the immunization in the schools, kailangan po nakapagsagawa ng orientation sa mga magulang at sila po mismo ang magdedesisyon kung ibibigay po ang pagbabakuna sa kanilang mga anak. So basically the
Of that orientation,
Yes.
what is the percentage of acceptance on the part of the parents?
We are still getting the data po from the regions yesterday po for the kickoff since it's the day 1 po yesterday. So maybe we can have the data and present it to you later on. But yesterday po, ang original plan was just ceremonial vaccination in specific sites. But surprisingly, dahil po sa pinaigting na orientation po, ma'am, coming from the collaboration of DOH and DepEd, marami na pong mga magulang ang nagtatanong kahapon kung ano po ang schedule ng bakunahan sa mga paaralan. And for us to also not to halt the classes of the students, ayaw naman po natin na maiistorbo ang klase ng mga estudyante. Kaya po kami ay sumusunod sa schedule na in-identify ng DepEd kung kailan po tayo magkakaroon ng bakunahan. But again, rest assured that the parents' consent is secured before we give the vaccination to the children po. And this will also run up until November this year at mas paiigtingin pa po come Q1 of 2025. So we have different platforms po, ma'am, for the campaign dissemination po for us to battle misinformation about the vaccines. So we will be maximizing different platforms aside from television, radio, and print. We will also be going through the digital platform po dahil mas personal po na hawak ng ating mga kababayan yung kanilang cellphone. Literal na mas malapit po ang tao sa kanilang cellphone kapag nagbabasa o nanonood ng mga videos. So that is also part of our strategy in Health Promotion Bureau and Communication po, ma'am. So we will definitely penetrate the digital platform TikTok, Facebook, and even the digital platforms po of the LGU so that we can properly disseminate right information about the vaccines. And this particular strategy will also be applied in other priority areas of the department po.
Okay. Thank you for that update. Sige,
Thank you,
I
ma'am.
wish you all the best because I do believe that with proper communication we can do this, no? That's kasi hindi naman yata tayo nagkukulang ng desire to provide the information, but really it's the quality of the information. It must resonate with your audience. So if it's the parents you're convincing, then it's a particular message. But if it's also the child for future lifestyle changes that you, or lifestyle, not even changes, but lifestyles you want them to develop, then you also cater to those kids. Okay, thank you for that. So let's move on. May utilization rate. So, Secretary, can you address the question I raised about the additional uh, HEA budget? Kasi medyo na-surprise kami that there's additional request.
There is no more HEA in the 2025. The HEA is all fully paid.
4.7 billion?
Appeals.
No, but this is additional amount that was brought to our attention, what, how
4.9.
during our briefing, and this was not allocated in 2024. So
Yeah.
bago siya.
No, but this is not in the NEP. This is additional.
It's not the NEP. So then you will
Not in
ask
the
us to provide it now.
No, let me explain. When the budget for the HEA was given, we had a deadline for people to file. That deadline was finished, and because of the hearings of Senator Bongo, we extended the deadline and we extended it. And finally, there was a final deadline, and the total computation was a remaining 27.3 billion. And that was what was used. That came from the 89.9 from PhilHealth. So that's technically all paid. Unfortunately, we said that people can still claim because many people did not claim. So they thought there was no money that's going to be given. So now, after the money has been paid, there are now additional appeals. And the appeals are now amounting to 4.9 billion. Of course, we will validate first these appeals if they are true health workers that served during the COVID claim. Kasi matagal na yun. 3 years ago pa yun. Kaya nga.
Because, you know, like anything in life, may mga deadline on filing. Hindi naman
Correct.
pwedeng forever tayo, 5 years from now, if I'm still chairing this budget hearing, may sumisingil pa ng allowance from 5. I mean, this is in no way disregarding the work that has been done, but you have to file at the proper time. So if you're going to make that appeal to the Senate, I need to understand the reasons why this amount is only coming in now.
Ma'am, no, this amount is not being appealed to the Senate. This is the amount that is now currently claimed by these appeals. We're going to review them because not all of them will be approved. I'm sure a lot of them
Oh,
are
sige. So
follow up.
hindi
So
nyo na
we
ilalapit
need to
sa
go
amin
through
yan,
a
bahala na
clearance.
kayo. You're
We
not
have-
gonna come to us for that?
Yeah, because we had the deadline, the end deadline is really, kailan? We moved it to the October 31. It was already supposed to have been last year.
May 20. Well, if you're telling me that it's not our job to produce that amount, then I'm not gonna worry about it. I'm not gonna waste my time thinking about it. That was brought to my attention.
I will have to verify if it's really indeed 4.9 because that's the current appeal, 4.9. But we'll have to look at each and every claim first, and then we will
Uh-huh.
give the amount, final amount. Yeah, we will request DBM.
Oh, kasi nung as of October 1, 4.67. So meaning to say between October 1 and October 8 isang linggo, naging 4.9.
So, yun ang problema, ma'am.
Ayun ang
Kasi
problema natin.
yung mga Pilipino
Sana
pagka
kayo
deadline.
magkaroon ng disiplina sa mga ganitong bagay. Again, I don't know the details, but I'm just saying na hindi tayo pwede forever binabalikan natin ito, no? Okay, sige. Let's move on. Yeah, so Secretary, I'm a little bit confused with your report and the information I have on the utilization for HFEP. No, these are the health facility enhancement program, because the data I have is that the disbursement rate from 2019 to 2024 is 17%, 39%, 36%, 34%, 36%. And 2024, which obviously is not ended yet, has not ended yet. So as of August 13, 13%. So kahit wag na natin pansinin yun eh, wala man lang umabot ng 40%, Mr. Secretary. So paano ba yan? Ang hirap naman kasi I'm your self-declared champion here, okay? From the syntax law that provides the funding, from pushing to the funding, from making interventions, I'm always doing it. But if your utilization is so low, eh kaya tayo well, not you DOH, but PhilHealth, there's hesitancy in supporting these programs. So do you wanna study this first and get back to me?
Ma'am, I have the October 7, as of October 7, financial report of HFEP. For 2024, it was 18 billion. We have obligated 40.6%. The disbursement is still 12. Kasi ma'am, mga construction to eh.
Yeah, I
So
know.
the releasable.
I
For
actually said that
20
I have
yeah.
13. It must be
For
12 point something.
2023, the obligation is 86.7%. The disbursement is 54.34%. For 2022, the obligation is 85% and the disbursement is 79.8%. And for 2021, it was 83.55%. The disbursement is already 89.39%. And the farthest is 2020, 100% obligation, 95.52%. Ang reasons, ma'am, for sometimes very low absorptive capacity is number one is the project modifications. Marami sa aming budget sa HFEP, ma'am, comes in after the GAA is published. So when we look at them, some of them have land that is not ready or the preparations are not ready. So we end up modifying, which takes time. So we end up transferring them. So in fact, for the solution to this, what we have done is now instead of putting in the NEP the specific location or lot, we only give the specific province. This way, we are able to move the project to a different area. Another one is really many of those projects that are approved still do not have detailed architectural and engineering designs. And then because these are projects of local government system, local health systems, we need to prepare an agreement. So sometimes there is a delay in this, and also the terms of reference, especially for equipment, that's the cause of the delay. And then failed bidding. Marami kami, ma'am, nag-fail yung bidding. They end up failing. And then there are also those that win the bidding and yung win and run. They end up, after the first tranche, they don't continue the project anymore. So we have those cases, many cases in the HFEP project. In fact, because of these problems, for the 2024 budget, I allocated a lot of I think 8 billion to DPW, 10.8 to DPWH so that they're more expert in the field of construction. So I decided that for the local health projects of HPEP, we delegated some of these projects to DPWH. Yeah. So we admit that for engineering and construction, the expertise is also with DPWH, and they have more engineers. We have a lack of engineers to actually go and monitor all these projects under the funds.
I'm actually grateful that my colleagues aren't here because as chairman, I don't take the floor. I normally don't take the floor until my colleagues ask questions. So I can facilitate their discussions, but since they're not here, I have this opportunity because it's a very important topic. First of all, Secretary, you have staff telling us that it's DPWH that's the problem and they prefer that DOH handles it. And if I'm not mistaken, last year, this was also the case. You had a different, you were telling me let DPWH, and you had staff telling my staff that dapat kayo humawak. And I remember going back to you and saying, ano ba talaga? So kindly clarify that with your staff, because they should be getting their instructions from you. Maybe some of them have been there longer than you, whatever it is, right? But kindly just handle that.
So what was transferred to the DPWH for local health systems, LGUs? What is retained in the DOH are the DOH hospitals, DOH facilities, TRCs. So tama yon, both of what my staff are saying and what I are saying are both correct, because hindi naman lahat tinransfer. Hinati po namin. Also, 5 million or less, kami na gumawa. The smaller amounts, the RHUs, the BHS, kami na rin yun, kasi 5 billion and below, 5 million and below, kami na nagtutok nun, even if
Yeah,
they're
that's
local
in the GAA.
projects, kasi
Yes.
madali naman yun.
Okay, but just to clarify, on this utilization update and also on this topic, your staff is just giving us the detail, that info that you have now. So the info they gave me on the utilization rate, which is different from yours, mine is dated August 31. If they're gonna update it, they should also update me. I'm wasting my time. I'm wasting my time asking you when I could have had a different report. Sayang ang oras natin. And if I didn't take it up now, my staff will also take it up. So kindly inform your staff na kung ano yung bibigay sa'yo, bigay din sa amin kung mali. Dahil inaaral din naman namin to. Ito, right now, this current conversation is a waste of time because hindi up to date yung information ko. Okay? And then itong tungkol sa yung sinabi ko na ano ba talaga si DPWH, ngayon lang din pinapasa sa staff ko. Oh, ba't ganon? So pag hindi ko tinanong, iba yung alam ko, iba yung alam nyo. Hindi tayo pwedeng ganon. So this is new to us. This is like I think this is a memo updating us, or what is this? This might be a joint Okay, it's a proposal for special provisions, and it says that the one here is fine. That the DOH at its discretion may enter into a MOA with the DPWH for the implementation of the foregoing infrastructure project, including new legacy projects. So this provision is new. So whatever it is, I just like it to be organized. If you're still discussing it, just tell us. But I don't like my staff to be briefed and then they brief me and then iba yung sinasabi nyo sa akin. Waste of time natin pareho yun, Secretary, di ba? So just tell us now they're currently still discussing with you, whatever, that's fine with me. Okay, let's not have to put ourselves through this. Anyway, so for the reasons that you gave on the reasons for the delay, in DepEd, which as I've said, I've handled their budget as well for 6 years. They have a validated list already. Lahat ng sinasabi mong reasons, valid yun. Pero kung na-pre-validate na yun, hindi na dapat pumasok yung projects doon. Paulit-ulit na lang tayo dito. It's not that difficult naman. So, you have a pre-validated list. Whether, wala akong pakialam kung sino pa nag-request sa inyo ng secretary, wala akong pakialam. Because in DepEd, they're able to do it. Kung wala ka dito sa list, choose a project. If they go to the senator, pakipondohan naman to, nasa validated list ka ba? I'm more than happy to. Because if not, experience tells us na hindi rin magagawa yan this year. Pa-validate mo yan. Tapos next year, babawi tayo. Get it done that way. Otherwise, we're all wasting time. It's not that difficult to have a validated list. So di wala, wala kang na-propose na site na maayos yung titulo, na maayos yung transfer, na donate ba yan? Hindi maayos na, hindi pwede. Hindi na napupondohan. And it's so easy to prove it now. Take a look at that list now, yung hindi nyo nagawa, ibalik nyo sa mga nagre-request. Lahat ng request na yan, valid naman. Wala namang magpapatayo ng health center for the wrong reason, di ba? Anin ba nila yan? It's for the right reason, pero pag minamadali, hindi na naman napupondohan. So you can do it that way if you need to coordinate with. So what happened was 6 years ago, I had the same discussion with DPWH and DepEd. And precisely ganun din ang nangyari. Pag pumasok si DPWH dun sa mga lugar na binigay ni DepEd, dati, hindi ngayon. Ay, hindi pa pwede, either hindi usable yung land for legal reasons because it's not owned by the government, or it's not in a place that's safe. May ganun pa. It's in a disaster risk zone. So this is not that difficult to do. Just go through the process.
Yes, ma'am, we'll do that.
Those reasons can be addressed. At pati itong mga bidders, okay? That's not my line. I have not been a local government official, but I know enough to say, go to each province and conduct seminars with them and validate contractors that have gone through this and either already have experience or have gone through the process of being educated on what are the requirements for health facilities. Then sila lang ang papayagan nyo. So, madelay man kayo this year, in the next few years, maayos na. Kasi maayos na yung listahan ng mga contractors nyo. Iban nyo na dyan yung, sabi mo nga, magbibid, mananalo, mawawala. Hindi, iban nyo. Put it up in a public site na ban na to kung may kalokohan sila sa inyo para wag naman sila magkalokohan sa DepEd. Share that information. I mean, I don't have to lecture you guys on this. Alam nyo na to, but it's the reasons you're giving me. So therefore, I have to lecture. Yan, yung mga no detailed engineering design. Eh, dapat wala sa validated list yun. O yun ang patulan yun kung wala. I know you're not engineers, you're a doctor, but same. I'm not an engineer either. I'm not a doctor. I'm a lawyer. But you learn these things. So let's get it done in an organized way. Otherwise, I feel bad because your intentions are very good. You have no desire. You gain nothing by delaying it. In fact, it goes on your record na delayed. So, pa-action lang sa staff nyo, secretary. Okay, let's move on. Yeah, so the healthcare workers gap, just a very quick response. Like I said, I'm in a unique position where I work with CHED and DepEd. So sa DepEd pa lang, ine-excite na natin, this should be part of national security. Ine-excite dapat natin yung mga kabataan natin on what are the exciting fields that they can look into, whether it's health, engineering, IT, and on the health side, kayo dapat na nag-feed niyan sa curriculum ng DepEd, di ba? And you know, alam ko naman yung usual textbook sa DepEd eh. Gusto ko maging doktor, gusto ko maging engineer, gusto ko maging piloto. Go deeper, di ba? The older they are, maybe a 6-year-old can't differentiate the different kinds of doctors, but maybe the 10-year-old can already start in understanding na ano ba yung radiotech, ano ba yung physical therapist, yung lolo mo na stroke o ikaw ang nagpapagal. Ang dami natin pwedeng gawin. So, work with DepEd closely. I'm happy to facilitate, but you need to get this desire to enter into these fields of work at that early age and then work with CHED to create this program. So I really like a detailed report on that, Secretary. Sana before plenary. Kasi taon-taon, Doktor para sa Bayan, okay na tayo. I think it's running quite smoothly. Pero asan yung allied health professions? And there's a shortage talaga with physical therapists, speech therapists, radiotechs, right? So, and you know more. When we first met, you told me also about the higher level health professionals that talagang wala tayo nun. So, let's get it done.
Yes, Madam Chair, we'll do that. Actually, as an update, I've met both the previous DepEd secretary and the current DepEd secretary and the previous TESDA secretary. I met them all for these ideas of inculcating them. For TESDA, there's very interesting project before of creating health assistants. So our emergency medical technicians, nurse assistants, technicians in the lab. So rather than waiting for the very long medtech, radtech, all these devices now are automated.
So
all you need
now
is a
have
guy
the
that knows how to
assistants.
turn
Okay.
on.
Because I was gonna go there. So you have that. Can I get a report if you're not ready now? How soon will they be ready? Because the example I was gonna give as radtech medyo, I find that very technical. So I won't even use that as an example. But I can use an example for physical therapy because we also have a shortage of physical therapists. The example I'll give is based on my own experience as an athlete, as a female, as a human being who needs to move my body and in the process I get injured or I need to move more body parts other than others. So I was recently traveling and I came across this franchise. It's a business, it's a franchise, and all they do is stretching. Stretching. So I did 2 sessions. I was very impressed, and I asked them what their training is, and they are not physical therapists. They are stretch therapists. So this would go under the physical therapist as well. They're trained to stretch you properly. So yun palang naisip ko na eh. I'm not even a senior citizen yet. I can just imagine, and I've been healthy and active, thank God, all my life. But I can just imagine somebody who's not been active to have that gift na may magsi-stretching sa'yo. Ang sarap talaga, parang you're like a different human being when you stand up. And it's a stretch therapist. Pwede mong pagawayan sa mga bulag. Pwede mong pagawayan sa out of school. And I asked what their training is a Japanese franchise. And there's more. It just so happens yun yung na-try ko. And it's a good paying job. So, yun. So, ang daming natin pwedeng gawin na ganon, di ba? Because I undergo therapy all the time. Preventive and interventional because I'm an athlete and I continue to compete in competitive sports. And definitely with proper training, you can get nga like exactly what you're saying. So I'm just using that an example because when people watch this, I want them to understand it. Baka mas mahirapan intindihin yung sinasabi nyo. But tama rin, I agree din with you, what you said. Di ba? Pinupindot lang yun. So under the supervision of the professionals, we can really train others. And which brings me to the case in point also, yung inyong clinical care associates. I had mentioned to the one of the USECs of DepEd that you have, that was one of your very first projects, and that I'm very certain if they have not spoken to you yet, you can the DepEd can already hire these clinical care associates of yours because they have a need in the schools. And definitely we don't have enough nurses or doctors to man all those schools, but you can now use them. So kayo na, I'm just here to remind you that they have a need, and I reminded them that you have the resources, so you can come together, and these clinical care associates of yours can be targeted on pediatrics, di ba? So iba naman dun sa ibang lugar, pero for the DepEd needs on pediatrics.
That's a great idea, Madam Chair. I'll work on that.
Yeah, I'll tell Secretary Sani that you said it's a great idea, so we can proceed after this. Okay. So yeah, and then yung sa CHED naman, I know you already have this joint admin order for the upskilling of clinical care associates, yan na yon. And then there's the enhanced master's program for nurses. And then the Philippine credit transfer system for dentistry, agriculture. Okay, so hindi ko pa nakikita dito kasi ito naman siguro yung sinasabi ko, pang test na naman, where you have these physical therapists, training, yun nga, training whoever out there. I would love to undergo the training. I would volunteer and do it for athletes. So there's so much we can do if we just find time to work together. Okay, I'll leave it at that so that I can give the floor to PhilHealth, and I hope our colleagues come soon so you can go back to your work and not spend the whole day with me. I'll give you the floor.
Thank you, ma'am.
President
Yes.
Ledesma.
Thank you, ma'am. And good morning, good afternoon. Again, Honorable Senator Pia Cayetano. Good afternoon to Honorable DOH Secretary Ted Herbosa. And good afternoon to our respective DOH families and PhilHealth families. PhilHealth, ma'am, is grateful for this opportunity to discuss PhilHealth's programs, priorities, and the proposed budget for fiscal year 2025. PhilHealth, ma'am, is celebrating its 30th anniversary next year. With this, PhilHealth is streamlining its programs within the medium term with a set of deliverables from 2025 until 2030. Developed to reach all Filipinos and bring affordable care and enhanced services, the streamlined priorities are anchored on sections 5, 6, and 7 of the Universal Healthcare Act, otherwise known as the 3 dimensions of the UHC: population coverage, service coverage, and financial coverage. The priority programs are thus categorized also into these 3 major commitments. First commitment is all Filipinos have the capability to use their PhilHealth benefits. With all 116 million Filipinos already covered under the National Health Insurance Program this year, 2024, and it is set to increase to 118 million in 2025. The focus shifts to increasing awareness and eventually improve utilization. Second, all Filipinos have wider access to health services through primary care. PhilHealth continues to promote its banner primary care program, the Konsultasyong Sulit at Tama or Konsulta Package. Next year, the goal of establishing a comprehensive outpatient benefit package comes into fruition as PhilHealth targets to shift to the improved Consulta Plus package. Lastly, all Filipinos are better protected against health financial risks. PhilHealth continues to improve financial risk protection by improving its packages with the goal of lowering household out-of-pocket expenses. These commitments are all aimed at transforming the corporation into a more responsive, efficient, and sustainable organization as we progressively realize the mandates of the UHC Act. Next slide, please. For this part of the presentation, please allow us to share the various benefit packages lined up by PhilHealth starting 2023, this year 2024, and until next year 2025. In 2023, PhilHealth implemented its first set of benefit increases for conditions such as high-risk pneumonia and acute stroke. Hemodialysis sessions were expanded from 144 to 156. Another round of enhancements for Z benefits was introduced, particularly on colon and rectal cancers and select ortho implants. The outpatient benefits package for mental health was also launched, offering general and specialty mental health services. The Consulta benefit package was again improved, emphasizing the importance of primary care, particularly the integration of SDG-related benefit packages, tuberculosis, outpatient HIV/AIDS package, malaria, and animal bite. And the launching of PhilHealth Gamot, which stands for Guaranteed Accessible Medications for Outpatient Treatment. Consulta's pharmaceutical service delivery arm, where it increased the number of drugs and medicines covered from 21 to 53. Next slide, please. This year, PhilHealth has already introduced a number of benefit improvements. Most notably, the year started with a 30% increase almost across the board of almost all benefit packages. The breast cancer package was also improved, and 2 enhancements were also introduced for neonatal sepsis and bronchial asthma. The capitation rates for Consulta was also increased from 500 to 1,700 per capita to cover the additional services such as breast ultrasound and mammogram. The hemodialysis package was also increased from 2,600 per session to 4,000, and with another round of increase up to 6,350 to be released within the month. Most recently, the guiding principles for the supplementary package PhilHealth Plus has already been released as well. PhilHealth also officially launched last week the Outpatient Therapeutic Care Services for Severe Acute Malnutrition benefit package, or SAM, which is aimed to address the prevalence of malnutrition among children. On a side note, the UNICEF recognized the package as the world's first primary care and social health financing package funded through national health insurance. For the remainder of the year, members can still expect numerous benefit packages to be released. These include another enhancement for hemodialysis, as earlier mentioned, a package on physical and medical rehab services, dengue package enhancements, chemotherapy, package improvements as mentioned by PBBM in the 2024 SONA, emergency care services, and more Z benefit package enhancements, especially cancer, which was recently discussed in the Committee on Health and Demography hearings. Please allow us to highlight the benefit for emergency care services. It is a standalone benefit It is a standalone outpatient benefit that will be part of the comprehensive outpatient benefit package or Consulta Plus. This shall cover the urgent and emergency medical needs not requiring 24-hour confinement. This package shall also include interfacility ambulance transportation and would initially engage hospitals through accreditation and contracting. Moreover, members can also expect another round of increase for our all-case rate packages. This additional increase is aimed at providing better support and further reduce patient out-of-pocket expenses. This substantial increase also increases compensation for healthcare providers, which in turn is expected to improve service quality. May we also share that the corporation has a two-pronged approach with regard to these increases. The first is an across-the-board enhancement, and another is a more targeted approach or a benefit-specific enhancement, such as the earlier released packages on pneumonia, stroke, and hemodialysis. The second approach is essentially based on burden of disease and to some extent availment patterns or need. So this second approach, ma'am, we are looking at is to increase the top 10 most common diseases based on morbidity and mortality. And maybe each case will be slightly different depending on the need. No? However, may we also take this opportunity to note that ensuring financial risk protection requires a whole of government, whole of society approach, as stated in Section 2 of the UHC. Hence, we enjoin our partners, both from the public and private sectors, to complement these increases in PhilHealth packages in order to sustainably lower household out-of-pocket expenses. Our combined efforts shall reduce financial stress for families, enhance overall health outcomes, and foster a more equitable and sustainable healthcare environment for all Filipinos. Next slide, please. Next year, 2025, PhilHealth intends to implement enhancements in its provider payment mechanism, another realization of a universal healthcare mandate. The diagnosis-related groups, more commonly known as DRGs, shall be implemented in select sites. DRGs intend to make payments more responsive to inpatient care's complexities and improve providers' efficiency by linking clinical standards and resource needs. Ultimately, this allows PhilHealth to take on a more substantial strategic purchasing role and incentivize optimal health outcomes with more rationalized resources and expenditures. Next year, another universal healthcare goal, the comprehensive outpatient benefit package, would also come into fruition. All the developments in primary care, such as Consulta with SDGs, the PhilHealth Gamot, capitation increase, etc., eventually lead up to the comprehensive outpatient benefit package or the Consulta Plus. Aside from this, PhilHealth has also lined up the following benefit enhancements. On kidney transplantation, cervical and prostate cancer, open heart surgeries for children, and assistive devices for children and disabilities. All these developments underscore PhilHealth's unending commitment to provide health insurance coverage and ensure affordable, acceptable, available, and accessible healthcare services for all Filipinos. Next slide, please. The benefit enhancements we just reported are essentially the original plans of the corporation. However, with new directives and discussion from stakeholders, PhilHealth is also working on an additional set of benefit improvements for our members. Next slide, please. One of the immediate changes requested from PhilHealth is the removal of the single period of confinement rule, or SPC. PhilHealth is also delighted to report that its board of directors, led by its chair, DOH Secretary Ted Herbosa, has already approved its lifting with effectivity for readmissions beginning October 1, 2024. Another commitment, PhilHealth is preparing for another round of increases for all case rate packages. The corporation intends to introduce the enhancement as early as this November. Third, coinciding with the Congress deliberations on the UHC amendments, PhilHealth also fully supported the premium decrease. This is already integrated in the Senate Bill 2620, and the House version is already ready for finalization. Fourth, one policy also asked from us to review is the engagement of health information technology providers. The Senate has asked to minimize the number of contracted providers to streamlining processes and for control purposes. While this service was conceptualized with the idea to fast-track claims processing by working with the preferred systems by our partner facilities, our IT sector is presently reviewing the proposal, and we will be consulting concerned offices accordingly and pilot test options as necessary. Further, another set of enhancements directed to PhilHealth is the coverage of diagnostic tests. These include the following: PET scan, CT scan, MRI, ultrasound, pulmonary workup, ear exam, eye exam, and SGPT, among others. Most of the select outpatient diagnostics are currently covered under the Consulta package, SDG benefits, and Z benefits. Expansion of coverage of diagnostic services is currently being studied as a separate package for primary care and specialist care in consideration of relevant national clinical standards and recommendations of the Health Technology Assessment Council, or what's more known as HTAC. Lastly, prior to PhilHealth's commitment to both houses of Congress, PhilHealth has already considered including dental services in its primary care package. In fact, PhilHealth is already in discussions with the DOH and the Philippine Dental Association to discuss the possible inclusion of preventive oral care services in the Consulta package. The Consulta package shall cover basic oral health, such as oral checkup, fluoridication, prophylaxis, and tooth extraction, to be harmonized with the ongoing efforts of the National Oral Health Program. While PhilHealth already covers some dental procedures under its case rates, it still recognizes that oral health is provided in different levels of care. Aside from the basic oral health that will be integrated in the primary care, a separate benefit package shall be developed to cover minor outpatient dental procedures such as complicated tooth extraction, odontectomy, alveoplasty, and gingivoplasty. All this will be included in the future enhancements of the benefit. With this, the PhilHealth Corporation has directed its concerned internal offices and is in the process of prioritizing and reviewing the proposals and intends to possibly release these enhancements in the coming months. Next slide, please. This part of the report details the proposed budget for fiscal year 2025. For fiscal year 2025, PhilHealth initially proposed a 150.92 billion budget to cover the premiums of 25.28 million individuals under the indirect contributors and 21.17 billion for the benefit package improvement pursuant to Section 37 of the UHC Act, totaling 172 billion. However, the Department of Budget and Management, DBM, has only appropriated 53.26 billion to cover the health insurance premiums of 14.18 million indirect contributors and 21.17 billion to improve benefit packages. Comparing the 2024 GAA to what was recommended by the DBM, PhilHealth's budget increased by 21% from 61.514 billion to 74.431 billion. While the corporation's initial proposal was not adopted, PhilHealth continues to enhance and release new benefits. Moreover, Filipinos not covered by the appropriation can still avail of benefits anytime to the corporation's immediate eligibility rule as mandated by the Universal Healthcare Act. Next slide, please. Sorry, that's the end of my presentation, ma'am. Thank you very much.
I'll ask my questions in reverse. Can you just put on the last slide since that's the top of mind? The one about the
The budget allocation, ma'am.
So what I'd like you to clarify, my job here is to help you clarify your budget, ha. My job is not to confuse people. My job is to ask questions so that you can clarify it. And if I disagree or if I feel you can do a better job, I'll share my thoughts on it. So I'd like to give an opportunity to explain that when you say 33% increase in member coverage, do you mean that you are not covering a certain percent of the population? Is that because when you say 33% increase, then it means may dating hindi na cover at sino pang hindi na cover? Is that the implication? I know the answer, so I'm just asking, giving you the chance to explain.
Thank you for your question, Honorable Senator Cayetano. So when we just to clarify, ma'am, no. So when we say 33% members increase, we are talking only particularly about the premium subsidy for the indirect contributors.
Talking about is the increase in the budget allocation given to you by DBM in 2025 compared to 2024. 10.65 million members were provided with subsidy amounting to 40.34 billion in the 2024 GAA, and it is now 53.26 billion to cover 14.18. So that is the 33% increase. Is that correct?
Yes, that's correct, Madam Chair.
But regardless of the subsidy given by government, you are mandated to cover all Filipinos. Is that correct?
Correct, Madam Chair.
So there is no intention here to state that there's a percentage of Filipinos that are not members and are not covered.
Yes, Madam Chair.
Oh, I'm helping you do your job para mas klaro sa mga tao.
Duly noted, Madam Chair. Thank you, Madam Chair.
Say that medyo apparently merong nako-confuse din na health advocates natin na worried sila na ang ibig sabihin ng presentation nyo of these numbers is meron pa kayong ibang more detailed presentation showing na sino yung mga hindi nabigyan ng subsidy. So ang impression is hindi nyo ngayon i-cover. Hindi naman ganon.
Hindi, Madam Chair. And actually, Madam Chair, thank you so much for that clarification. Duly noted.
Okay.
And
Fine nun, hindi ako. So, but di ba? I want to help you because
yes, Madam Chair.
ko naman balak nyo silang i-cover. So kung ano man ang ibigay sa inyo, you will cover everyone.
Yes, Madam Chair.
Especially because marami kayong pondo at pinamigay nyo pa yung pondo nyo. So there's no reason not to cover everyone.
Yes, Madam Chair.
Okay, sige. Okay, so clear na tayo dyan. So, okay, I want to go to a previous slide wherein, or did they show that slide or do I just have that because your staff gave me some slides? Yung 30%. Or do we have that or that's the, I'll go straight here.
Meron po sila. Yung mga benefit packages for 2023. 2024.
Yung benefit packages for 2024. Good morning, Senator Bongo. I'll just finish a few questions. Then I'll
Salamat,
give you the floor.
Madam Chair.
Okay.
Next.
Next pa.
30% increase.
Okay, there we go. So under February, you have here in green, it says 30% increase for case rates. Of course, pag ako yung ospital, happy ako dahil finally, to give context because people watching may not understand this. So a lot of small hospitals in particular, or sometimes even big, but private hospitals complain that the case rate is too small, right, to cover their expenses. So now, you're showing that in 2024, nag-increase kayo ng case rate. So kung ano yung dating budget sa particular na sakit, mas by 30% na ang re-reimburse ng ospital. Tama? Okay.
Yes, ma'am. Ma'am, if I can just highlight, almost across the board. So, ma'am, there are currently 9,000 case packages. So almost almost all of them, ma'am.
Sige. So I will now tie that in. Thank you for that clarification because that might be somehow answering my question already. Si COA naman has said na what is the basis for that 30% increase. Sabi ni COA, the automatic adjustment of case rate based on an inflationary factor of 30% is without a concrete basis or methodology to identify the incremental rates, indicates weak internal controls and haphazard program and policy implementation. This could lead to excessive reimbursement, resulting in financial inefficiencies or inadequate coverage, compromising the quality of healthcare services accessible to the public. So, for context lang, as I said, I was chairman of the Committee on Health since 2004 for 9 years and then handling this budget for 5. We know for a fact that some case rates are considered, well, they are outdated. Tama ba? 15 years or 19 years? 12.
2013, Madam Chair.
So, 12.
So roughly around 11 to 12 years, Madam Chair.
Have not been increased. So obviously there has been an increase. So again, for context, hospitals are limited to a reimbursement of those old case rates. That's why it is really time to increase. But as early as was I in the House when we went to WHO? House. I was a member of the House of Representatives from 2016 to 2019. So somewhere then, 2017, 2018? Anyway, maybe around 2018, I was in Geneva and I had a briefing with WHO. And they told me that they were helping the Philippines adjust their case rates. Not to be more, to be more realistic and responsive to the needs of the Filipino patients. So, yun na nga, that was 6 years ago. And then now, so I know it's a tedious process. Sabi mo nga, ilan yon? How many
9,000 case rates, Madam Chair. And anyway, go ahead, Madam Chair, then I'll address your question.
That we can identify the top 12, the top 20, the top 30, the top 100 to prioritize that. Dahil yun naman yung paulit-ulit. So, I go back to the observation of COA na sabi ni COA, medyo haphazard daw nga yung pagkagawa nun. So, is it, and you did say that that's more or less, no? So, is in fact, hindi rin ba naintindihan ni COA na baka for some 60%, for some 10%, kaya ka nag-average ng 30%? Is that the case, Mr. Ledesma?
Yeah. Ma'am, can I answer your question, ma'am? Yeah. Actually, ma'am, thank you very much for the very, very excellent question. No? I'm glad you asked that question. Give me a chance to explain. No? Ma'am, first of all, ma'am, I'll just backtrack a little. So we implemented a 30% increase almost across the board. So almost for all the 9,000 case packages last February 14. Okay. And then in a congressional hearing a few weeks ago, I announced, ma'am, that we are working at PhilHealth to do another round, most likely 30 to 50% increase. Again, almost across the board by November. Okay. Now, when I did that, ma'am, Honorable Congresswoman Stella Kimbo, in the corner mentioned to me that, oh, that's very good. But she said, but can I suggest something else? Sabi ko, what's your suggestion, ma'am? Her suggestion was, instead of doing another round of 30 to 50%, maybe you can focus on the top 10 most common diseases by morbidity and mortality, no? And these top 10 most common diseases comprise, ma'am, 80% of that 9,000 case rates, almost 80%. So it's actually very similar, ma'am. But Kong Stella felt that this would be better, and same with our team in PhilHealth, because it wouldn't be as inflationary, ma'am, and at least it will address, because some of the more common diseases need more increases than the others. So to fix it across the board sometimes is does not do the trick, ma'am. No. So to answer your question, ma'am, we understand where you're coming from. We understand where COA is coming from, and instead of implementing a targeted 30 to 50 sorry, ma'am. Instead of implementing an additional targeted 30 to 50% increase almost across the board this November, we are more inclined, the team in PhilHealth, we're more inclined to looking at an increase, a corresponding increase on the top 10 most common diseases by morbidity and mortality. And each increase will not be uniform. Each increase depends kung anong mas common or mas kailangan, baka mas malaki yung increase. Depende yan doon, ma'am. Now, lastly, ma'am, sorry, ma'am, before I ma'am, I just want to read also lastly. Where's the COA? Can I see the COA? Anyway, ma'am, okay, for now, ma'am, that would be my answer. I don't know if that addresses your question, ma'am.
It does partially, but not quite. I don't think you've answered my question, my specific question. You have attempted to answer my question, but what I needed to hear, similar to COA's observation, is what happened to the detailed
Oh, yes.
analysis of the actual expenses per case that is needed to give a more specific case rate increase and not just an across the board.
Yeah.
Kasi nga,
No,
as early as 2018, na-announce, nabanggit na yan sa akin na ginagawa, and every budget hearing, ginagawa. Tapos biglang across the board lang pala ang kahinatnan. Eh, ba't pa tayo nag-abala for all these years na isa-isahin yun, tapos mag-across the board lang pala? That's my question.
understood, ma'am. Apologies, ma'am. Yes, that's the real question. And ma'am, if I, with your permission, actually, Dr. E. Vargas heads our HFPS in PhilHealth. No, it stands for Health Finance Policy Sector. He is in charge of all of these benefit increases and how it's computed and how it's done. Is Dr. Ish here, or can we have a representative from HFPS to explain the process? We'll explain very quickly, ma'am, the process of how we compute and how we come up with the numbers, no, like with the 30% across the board and
If somebody who's competent to explain. If there's none, then let's wait for your Dr. Ish to explain it properly. I just want it explained properly so that we don't take too much time. I can defer this till a little bit later. Senator Bongo is here ready to ask his question. So as long as I get a clear explanation, or you can take time to talk to him and so you can.
Yeah.
explain
Ma'am, with your
well.
apologies again, ma'am. With your permission, ma'am, just to make sure we submit a clear, concise, we'll put it together, ma'am, immediately, and then we will submit to your good office and to the.
Still like clear explanation. The details can follow later on within the hearing time. Because it's very important to me. Dahil ilang taon na yan ine-explain sa akin na it's a tedious process. Siyempre, iba yung gasto sa isang ospital, sa isang mas malaki. Tapos biglang naging across the board. So I want to understand how that happened. So short answer, a little bit later. Call your Dr. Ish.
Yes.
And let me know.
Okay,
So,
ma'am, sorry if I can just add one more thing. So we will do that, ma'am. We will comply. We will submit, and maybe we can also present you either privately or in a
Yes.
hearing. And then I just want to add, ma'am, so it's been 12 years since we increased the base packages in PhilHealth, no? Now, I came in 2022. As early as 2022 and even in 2023, we actually increased already some of the most common case packages. To give you an example, ma'am, we the hemorrhagic stroke we increased, and then the pneumonia, and then the hemodialysis sessions to 156. All of that, ma'am, was done. This was prior to the 30% increase across the board. This was done in 2023. No, so I think again, when we explain to you, ma'am, we'll show you that this is not all across the board. These are specific packages, which I think are most common diseases. No. So we will also impute that in our presentation to you, ma'am. So I just wanted to highlight that to this committee that we did that in 2023, and we did that, ma'am, on a year wherein the premium contribution was suspended by President Marcos. So we increased this.
President Duterte.
No, in 2023, ma'am, President Marcos suspended the premium contribution of PhilHealth.
Did it,
and
2023.
What I'm trying to highlight, ma'am, is we did these increases, huge increases, on a year when the premium contributions were suspended. Just wanted to mention that. Thank you very much, ma'am.
Okay, and then before I give the floor to Senator Bongo, I just want to put on record my concern, and then I'll let you explain later because I want to give time to our colleague. Just a minute. So, this is with respect to the issue that I raised in my opening statement about the transfer of PhilHealth funds in the amount of 89 billion. Yeah. So, one point I want to raise is in the documents that you've presented to us, in fact, that commitment of 89 billion, part of that are still receivables from what I know. So it adds to the shock effect of PhilHealth funds being transferred to the National Treasury when some of the funding being committed to transfer has not even been received by PhilHealth. That's one. I'm just gonna enumerate my concerns, give you time to discuss with your staff so I can give the floor to Senator Bongo. The second point on the same, this is all on the same issue that I want to raise. Since I chaired this committee, this subcommittee, these are the budget appeals of PhilHealth. In 2021, what year did you start, Mr.
I started in November 2022, Madam Chair.
Okay, so at least you can just verify this since you personally were not present yet at this time, no?
Noted, Madam Chair.
In 2021, 66.73 billion was requested by PhilHealth, and they indicated that 31.88 billion of that is for the benefit package improvement under the UHC Act. Then in 2022, what was requested is 30 billion for indirect contributors only. There was no request for benefit packages. And then in 2023, 69.51 billion was requested, and 34.99 billion of that was for benefit package improvement under the UHC Act. These requests were not approved despite the efforts of the chair to try to assist PhilHealth at that time. But what I'm trying to emphasize now is that since 2021, there were these budgetary requests. So it came as a shock to this representation when I heard that PhilHealth had committed almost 89 billion, despite the fact that in the past years, PhilHealth had been requesting for more budget for benefit package improvement, and we were not able to give it. The reason is always budgetary constraints. So I'm assuming that these benefit packages were left maybe not unfunded, but not funded to the extent that PhilHealth would want it to be funded. And yet, namigay tayo ng pera. So it's very, very confusing to me how that happened. And then I'll just add to this the COA report that said that the requirements for benefit packages to be adopted by PhilHealth in response to the Responsible Parenthood and Reproductive Health Act, which is my law, has also not materialized. And these are serious gynecological conditions. So later on, I will also ask you to report on that because it's very easy for us to hear a story about a woman dying from breast cancer. It's I believe the top female cancer killer. But there are other serious gynecological conditions that are unfunded, and you need to justify why you're able to commit 89 billion when these commitments under existing laws have not been met yet. I do not want to hear that there is a provision in the GAA that requires you to remit unused funds, because the point is it should have been used. That is my question. Why was it not used? Why were these funds not turned into benefit packages that could have been used? Because it's so easy to pull out people off the streets who will tell you that they went to a hospital and the particular condition that they have or their loved one had, hindi pasok sa PhilHealth benefits or kulang. So that is the question I need answered later on, because I will give the floor right now to Senator Bongo. Okay?
Thank you very much, ma'am. We noted on all your queries. We will put together answers and we will revert. Also, ma'am, just wanted to highlight although we will prepare all the answers to the question, there currently, I'm sure you're aware, ma'am, there is a case pending with the Supreme Court, no, on the 89.9 billion, no. It's currently ongoing. Just wanted to mention that, ma'am. Thank you very much. Thank you.
In context that this is a budget hearing and certain statements were made in the budget hearing. And so in this budget hearing, I also want clarifications on that. Thank
Yes,
you.
ma'am. Thank you, ma'am.
Floor is yours, Senator Go.
Salamat, Madam Chair. Balikan ko lang yung issue about this 89.9 unused funds. President Emmanuel Ledesma, kung sakaling yung 89.9 na walang excess kayo, kukunin kaya ng National Treasury yun?
I'm not sure of the answer po.
Oh, tama.
Hindi ko po alam po.
So ibig sabihin, hindi nyo muna ginamit yung pera ninyo. Doon namin na-discover na meron pa pala kayong 500 reserve fund. Alam mo, ganito pong storya niyan, Madam Chair. We had about 9 hearings na po about HEA, including the 3 about PhilHealth. Including your resolution, kasama natin dito, about the unused 89.9 funds. Doon po natin na-discover na aside from 89.9 unused funds na ita-transfer sa National Treasury, meron pa pala silang 500 billion na reserve fund. Habang ang mga kababayan natin nag-iingalo, walang pambayad sa ospital, nagmamakaawa, tapos kayo sobra-sobra yung pera ninyo. Alam mo, Mr. Ledesma, sanay ka, dati ka sa PISAM, puro kuryente yung collection sa kuryente yung iniisip mo. Baka makuryente ka dyan sa style mo. Kawawa yung Pilipinos, totoo lang. Di kita titigilan. Madam Chair, esteemed colleagues, and to the Department of Health. As chairperson of the Committee on Health, I want to emphasize the importance of the 2025 budget of the Department of Health in our path towards recovery. Ilang beses ko na rin pong nasabi, now is the time to invest more in improving our healthcare system. In our effort to further improve our healthcare system, we have passed this Congress Republic Act 11959 or the Regional Specialty Centers Act. This is to make specialized medical services available in all regions. Priority po ito ng Kongreso, priority po ito ng ating mahal na Pangulong Ferdinand Bongbong Marcos Jr. Hindi na po dapat kailangan pumunta ng Maynila ang magpapagamot sa heart center, NKTI o lung center dahil magiging available na po ang serbisyo sa mga DOH hospitals in various regions. On this note, we want to know from DOH the updates on the implementation of this law. Batas na po ito, and the budget allotted in 2025 for the establishment of specialty centers. I also want to highlight the decrease in the proposed funding for our specialty centers, such as lung center, heart center, NKTI, and Philippine Children's Medical Center should also be explained and addressed. Bakit po bumaba yung pondo nila? This is probably due to congressional initiatives for this year's budget that were not included for next year. Kaya tumaas siya for this year dahil may congressional initiatives. Pero bumaba siya for next year. Nevertheless, we should also look into this, no, and support additional funding for these hospitals. Importante po itong haba-haba ng pila sa mga hospital na yan. Congratulations po sa DOH, Secretary Ted, sa inyong cancer center na binuksan po kanina sa East Avenue Medical Center. Laking tulong po yan sa mga kababayan natin. At gusto ko lang pong banggitin sa DOH at sa lahat ng nakikinig na aside from itong mga specialty centers, meron po tayong isinulong na mga halfway house, ito pong Watchers Hall or bahay pasilungan. Para po ito sa mga watchers na nag-aantay sa kanilang mga pasyente. Napapansin ko, nandiyan lang sila sa bangketa, sa gutter, nag-aantay ng kanilang pasyente. Dapat po meron silang komportableng papahingahan man lang. Ngayon, malapit na pong matapos yung sa PGH, yung kanilang Watchers Hall o bahay pasilungan. At sa Philippine Children's Hospital, meron rin tayong isinulong na Malagyan at saka sa East Avenue. Philippine Heart Center, PGH, Quirino Memorial Medical Center, pati sa PCMC. Ito po ang tinatawag na balay pasilungan o halfway house para meron silang komportableng pahingaan habang nag-aantay sa kanilang mga pasyente. I'm also advocating for the continuous funding for the super health centers which I pushed for since 2022. Super health centers are primary care health facilities where consultation and minor treatment services will be available. Pwede po dyan magpakonsulta. Pwede po dyan yung inyong programa, Mr. Ledesma, inyong konsulta program. Diyan nyo po ilagay itong mga konsulta program ninyo. Sobra-sobra yung pera ninyo. Ba't hindi nyo ipa-accredit yung mga health centers, super health centers, mga hospital para may malapitan po yung ating mga kababayan? Gamitin nyo muna yung pondo ninyo para hindi mawalis ng national government. Mas makakatulong po ito, early detection, mas alam po ng doktor yan. Mas makakatipid po kayo pag early detection at prevention para hindi lumala ang sakit. Sana po patuloy itong masuportahan sa 2025 budget, itong mga super health centers. Bukod sa sapat na pasilidad at equipment, kailangan din nating pagtuunan ng pansin ang human resources o ating healthcare workers. Through our hearings, nakapag-hearing na po tayo ng siyam na hearing sa Committee on Health, we were able to press DOH and DBM to release funding for the Health Emergency Allowance or HEA po ng ating mga healthcare workers who served during the pandemic. Services rendered na po ito, pinagpawisan nila, pinagpaguran po nila. Kailangan pa ba nila magmakaawa? Buti na lang po nag-hearing tayo, at least narinig po ang kanilang hinaing. Kahit saan po pumunta, ang sigaw nila, pagsalubong pa lang sa akin ng mga health workers, ang sigaw, HEA, HEA. Kailangan pa ba nilang magmakaawa? Pinagpawisan nila yan. Services rendered po yan. At salamat sa DOH at DBM, narinig nyo po. Sulit po ang pangungulit natin. At ayon sa DOH, ongoing na po ang pagbayad sa unpaid HEA. At before the year ends, at nangako kayo, sabi nyo nga, before the end of October, ay fully paid na po ito at na-reconciled na po inyong mga records. But now, meron po mga appeals, no? I want to bring to the attention of this committee around 4.9 billion is still needed to cover the appeals made by some health workers. Nabuhayan po sila ng loob nung nakita nila, nababayaran po sila. Ayon po sa DBM at sa DOH na nung nakita nilang babayaran sila, nabuhayan sila ng loob, kaya may mga appeals. Kung qualified naman, pag pinagpawisan nila, pinagpaguran nila, services rendered, bayaran nyo po. Ang sabi nga ni President Ledesma, gagamitin yon 89.9 para sa unprogrammed funds. Baka pwede namang bigyan ng prioridad ng DBM ang unprogrammed funds ninyo sa Executive Department. Unahin nyo pong bayaran itong mga health emergency allowances po ng ating mga health workers. Bigyan nyo ng prioridad. We hope that the DBM would prioritize the funding for this through this year's unprogrammed appropriation. Baka naman po kaya na itong paglaanan ng budget sa taong ito para na hindi na po kailangan ipasok pa sa 2025 budget. Kung kaya naman po ng ating DBM, bigyan ng priority. May DBM ba rito? Baka pwede niyong unahin kung meron kayong mga unprogrammed funds. Mas importante po itong mga health emergency allowances po ng ating mga health workers. We must properly compensate our health workforce. Sila po ang nagiging frontliners natin sa panahon ng pandemya. Kayo po yun. Mga DOH, kayo po yung hero ng pandemya, mga medical frontliners. Dito po, including our secretary, nagserbisyo ka rin po sa task force noon against COVID. Including Yusek Berhere. Siya yung naging muka ng pandemya, araw-araw natin nakikita. Salamat sa inyong serbisyo, lahat ng mga taga-DOH. At ito po'y pinasa nating batas, ito pong HEA. Hindi po kayang bayaran ng kahit anuman po ang buhay at sakripisyong ginawa ng ating mga health workers. Aside from improving the availability of health services, equally important is the affordability and accessibility of healthcare. Kaya naman po nandiyan ang PhilHealth para tugunan ito sa ilalim ng Republic Act 11223 or the Universal Healthcare Act. lahat ng Pilipino ay miyembro po ng PhilHealth. Yun po ang hindi pa alam ng iba, kaya hindi sila nakaka-avail ng services ng PhilHealth. Kaya kailangan paigtingin niyo po inyong education campaign na lahat ng Pilipino po ay miyembro po ng PhilHealth. Kailangan, ang importante dito, maibigay ang maayos at magandang serbisyo sa ating mga kababayan, lalong-lalo na po sa mga mahirap. Madam Chair, as we all know, PhilHealth is due to remit 89.9 billion to the National Treasury. According to the DOF, this amount represents unused government subsidy. Nakailang hearings po tayo dito at nanawagan tayo sa PhilHealth na while waiting for the Supreme Court, no, sa kanilang oral arguments sa January of 2025, ang panawagan po natin sa PhilHealth, since meron kayong 500 billion na reserve fund, nangako po si President Ledesma during the first hearing, nare-recommenda niya sa Pangulo na babaan po ang premium contribution from 5% down. While waiting for you, sir, may pinasa po kaming batas dito, amending the universal healthcare, reducing the premium contribution from 5% to 3.25%. While inaantay nga namin yung rekomendasyon. Ginawa na rin po namin ang aming trabaho. Pangalawang pinangako ninyo, increase case rates. Aside from 30% this year, sabi nyo before the year ends, another 50% across the board case rates increases. Yun ang pinangako nyo. Tinatandaan namin yun. Pangatlo, expand benefit packages. Napakarami po dyan ng mga benefit packages na pwede nyo pong isipin pa. Halimbawa, sa mata, prevention po yun para hindi lumala yung sakit ng mga sa bata pa lang. Prevention na po yun, early detection na may diferensya sa mata. Dental. At marami pang iba. Isipin nyo po, ang dami pong sakit na dapat ninyong tugunan. Buti sana kung wala kayong pondo. Andiyan dyan yung pondo eh. Hindi nyo kailangan magtipid. Ibalik nyo po sa taong bayan yung pera nila. At pang-apat po, out of pocket expenditures talaga. Tulungan niyo po ang DOH, huwag kayo masyadong umasa sa medical assistance program po ng DOH. Kung mas malaki ang contribution ng counterpart ng PhilHealth sa pagpapalabas ng hospital billing, mas mababawasan po ang problema ng DOH, mas magagamit pa nila yung pera nila sa ibang mga kababayan nating mahirap na nangangailangan po ng tulong. Marami na pong naipangako ang PhilHealth at salamat sa inyong napagkasunduan na po ng inyong board na yung nirekomenda natin, yung scrap na po yun, tanggalin na po yung single period of confinement policy. Napaka-illogical, napaka-kalokohan po ng pulisiyang iyon na bawal i-cover within 90 days ang same na sakit. Ano yan? No repeat sakit policy. Ako, masintabi po sa kumakain. Kumakain ako sa tabi-tabi. Kumakain ako ng street foods, quick. Kung nagka-diarrhea ako ngayon, na-admit ako after 2 weeks, bawal na muli ma-cover ng PhilHealth. Mga nag-bleeding, buntis, maselan, bawal po i-cover within 90 days. Pneumonia, bawal po i-cover daw dahil dyan sa single period of confinement policy. Kalokohan yan. Salamat. In-scrap nyo na, tinanggal nyo na. At pang-apat po, pang-lima, nangako po si EVP Attorney Eli Santos nung nakarang hearing na tanggalin nyo rin po yung 24 hours emergency policy. Alam nyo ba na ngayon, pag nagka-emergency tayo, natahi, kailangan mo, kung gusto mo na umuwi, pili ka. Kailangan mo magpa-admit para ma-cover ka ng PhilHealth. Bakit hindi mo na lang gamitin yung pambayad sa kwarto para pandagdag sa gamot, pambayad pa sa ibang medical services? Tanggalin niyo po itong 24 hours confinement policy ninyo. Nangako po kayo na tanggalin niyo yan. Kalokohan po yan. Ang dami po mga hospital na sasabihin sa pasyente, pwede bang magpa-admit ka muna ng 24 hours para ma-cover ka ng PhilHealth? Ganun. Mas magastos na magpa-admit kasi magbabayad ka sa kwarto. Gamitin nyo yung pondo na dapat ibayad sa kwarto, tulong nyo sa gamot ng pasyente, take-home medicine. Ang dami pong mga polisiya na dapat ninyong i-review. Ito pong single period of confinement policy, sabi ninyo, 2013 pa itong polisiyang ito. Hindi nyo man lang napansin. Common sense po yan. Dami pang sakit na pwede ninyong pagtuunan ng pansin. Expand benefit packages po. Pakiusap ko lang po sa inyo, gamitin nyo po inyong pondo. At gusto ko po, nakikiusap ako, ipresenta nyo po sa committee ito kung ano pong plano ninyo sa inyong reserve fund. Okay lang naman magkaroon tayo ng reserve fund. Kailangan yan, if ever may pandemya ang darating sa buhay natin. But planuhin nyo po, kasi humihingi kayo ng pondo, ng subsidy every year dito. Anong point na hihingi kayo ng subsidy? And at the middle of the year, ipapabalik ng National Treasury. Bakit pa kayo humingi? Kung ibabalik nyo rin sa National Treasury, ang dami pang importanteng paglalaanan po ng pondo. Kaya, just a reminder, Mr. Ledesma, marami po kayong pinangako. Implement a substantial increase in the benefit packages for the top 20 mortality diseases in the Philippines such as heart diseases, diabetes, respiratory diseases, and hypertensive diseases by December 31, 2024. Increase and adjust case rates by 50% across the board by November 30, 2024. Next, expand and improve benefit packages, including dental benefit package, outpatient drug benefit package, or libreng gamot, coverage for optometric services, assistive devices such as wheelchairs and crutches. Bumili kayo dyan, tulong nyo sa mga mahirap. And coverage for emergency outpatient services in accordance with Section 7 of Batas Batas Pambansa number 702 as amended by Republic Act 10932. Sa dami po ng inyong ipinangako, mukhang ayaw mo nang pansinin yung committee. Nung huling committee hearing po, Mr. Ledesma, October 2, kayo po ang nag-set ng meeting na yon. Kayo po ang tinanong ko for the record kung kailan kayo available. Dahil nire-respeto ko po ang schedule ninyo kung kailan kayo available. Tinanong namin kayo. Ang sinabi ninyo, available kayo no October 2. 2 hours prior to the hearing, sasabihin mo hindi ka makakapunta. Nag-submit ka ng medical certificate dated October 1 showing recommendation of his physician to have a bed rest for 2 days. Pero 2 hours mo binigay sa amin, respeto naman po, Mr. Ledesma, kung gusto mong respetuhin ka rin po. Respeto lang po hinihingi ko kung gusto mong respetuhin ka. Bakit nung October 3? Tingnan nyo, kung sakit yung likod mo. Ito yung picture. Oh. Saan yung box pasa mo dyan? Hindi, may yung selfie. May selfie yan na picture. Kung sakit yung likod mo, bakit ka maka-selfie? Ano napakita? Respeto naman po. Oh. Diyan, Mr. Ledesma. Sakit likod mo niyan a day after our hearing, supposed hearing. Importante yung tinalakay natin dito. Alam ko importante naman po yung lakad na yan. You're with the President. Very important yan. Suportado natin yan yung mga programang makakatulong sa mga mahirap. Pero ikaw yung pwedeng sumagot dito sa Committee on Health sa mga katanungan. Ikaw nga yung nag-set October 2. Respetuhin mo naman yung komite. At papatawag natin yung nag-issue ng medical certificate dito sa Committee on Health kung totoo ba na na-check up ka niya. Marami na pong naipangako, Madam Chair, At ngayon, humihingi na naman ng 74 bilyong subsidy mula sa gobyerno habang napakalaki pa po ng reserve fund, 500 billion. It is incumbent upon us to secure the commitment of PhilHealth before approving additional funding to be given once again to PhilHealth. Baka ipunin lang nila ng ipunin ang pondo na binibigay natin sa kanila at makalimutan na nila ang pangunahing mandato nila ay ang suportahan ng ating mga kababayan sa kanilang pangangailangang medikal. PhilHealth po ay para sa health. Kaya nga po, PhilHealth. Gusto ko rin po explain nyo na mabuti sa publiko bakit yung Provincial Health Officer ng Camarines Norte, nagkasakit siya, binawas sa sweldo niya 200,000, nagtatrabaho siya as Provincial Health Officer ng Camarines Norte. Nung nagkasakit siya, 4 million, ang binawas 27,000 lang sa PhilHealth. Nung nagkasakit siya muli, 6 million ang hospital billing niya, ang binawas 29,000 lang. Namatay na siya, lugi pa siya sa binayad niya, na contribution niya sa kanyang sweldo. Baka pwede niyong silipin po ito mismo, Mr. Ledesma. Bakit nagkaganon? Pati yung empleyado ninyo sa Capi, sa Rojas, 800,000 yung billing niya, ang nabawas 30,000 lang. Tingnan niyo pong mabuti, baka pwede niyo ma-adjust inyong case rates. Moreover, Madam Chair, before approving their budget in the committee level, I want PhilHealth to sign a commitment letter detailing the promises they made during the committee hearings and other items pursuant to the mandates given to PhilHealth. Madam Chair, kung hindi kaya ng PhilHealth sagutin ang gastusin sa ospital, lumalapit ang mga pasyenteng walang pambayad sa mga medical assistance program ng gobyerno. Kaya po, importante na masuportahan ang mga medical assistance programs ng DOH. So we sponsor the passage of Republic Act 11463. Ito pong Malasakit Centers Act last Congress, including you as isa sa mga sumuporta at naging co-sponsor, to make access to medical assistance easier and more convenient. To ensure the continuous operations of the Malasakit Centers, I wish to have the Secretary of Health sign a commitment letter before we approve the budget of the agency, stating that DOH shall ensure the sufficient funding and assistance shall be provided to guarantee the continuous and uninterrupted operation of all Malasakit centers nationwide, and that the medical assistance to indigent and financially incapacitated patients program of the DOH. Ito po yung MAIF. Ito po yung dating MAIF, na inulit po ang pangalan, naging MAIF. MAIFIP. Dati, MAIF. So ngayon, ginawang MAIFIP. Itulong nyo ito sa mga mahirap. Maipit na nga yung tao, walang pambayad. Tulungan nyo po. It should be available po sa mga inyong hospital. Kayo naman po nakakaalam, meron naman po kayong mga social workers na mag-assess kung sino nangangailangan ng tulong, yung mga indigents po. Tulungan nyo po yung mga mahirap nating kababayan. A department memorandum must also be issued to this effect. With your indulgence, Madam Chair, and as a fellow health advocate, I hope you could support my endeavor on making the DOH and PhilHealth commit in writing in efforts which are clearly within the agency's mandates in accordance with existing laws. Dapat po ibalik niyo po ang pera ng gobyerno sa mga mahirap nating kababayan sa nangangailangan. Salamat po, Madam Chair.
Thank you. A minute suspension.
By some of the things that Senator Bongo mentioned. Is it okay? Yeah. Thank you, Madam Chair.
Sige, go ahead po, Mr. Ledesma.
Senator, good afternoon, no? Just wanted to clarify two things, Madam Chair, Senator Go, no? The first one was, you mentioned earlier that I committed to 50% increase po on the case packages for November. If I recall kasi po, what I mentioned was a 30 to another round of 30 to 50% increase po, no? So yun ang atang pagkaalala ko, pagka-recall ko ng sinabi ko.
Kita mo ngayon, i-review natin yung video nung nakaraan. Kaya nga tinawag kita na boy promise eh. Kaya kita tinawag na boy. Di ba sabi mo, cross my heart.
Okay. Anyway,
Nag-promise ka po, i-review ko yung transcript.
okay po.
It was televised live. Sinabi niyo po 50%. Anyway,
Yes. Well, okay. Anyway, po, if it will be shown that I committed 50, then we'll leave it at that po. I just wanted to clarify, no? But if you're saying po, it was really 50, we
can review the
yes po.
the records.
Yes po. The second one, yes po. Thank you, Your Honor, Madam Chair. The second one po was, you mentioned kasi earlier the top 20. We will adjust the top 20 most common diseases. Again, maybe if with your permission, Your Honor, if we can review it, what I mentioned was, and I mentioned earlier in the benefit plan which I presented this morning, it's actually not 20, it's top 10.
Okay.
Top 10 most common diseases po. Because po, the reason why it's top 10 po is because this top 10 comprise almost 80% of the total case packages po. So it was really 10, hindi po 20.
Okay.
But again po,
Okay po yun, top 10. Yun yung pinangako nyo, top 10. Anyway, our suggestion here is, kung maaari, no, na aside from the 10, make it 20. Dahil sobra naman po yung pondo ninyo. Kung maaari lang. Since you told us that you have a pending 9,000 case rates for review. Di ba sabi nyo? Am I correct?
actually, ang sinabi ko po, there are a total of
Tama ba ako? Sinabi nyo, there are total of 9,000
Yes.
case rates for review.
Yes po.
Ongoing, kaya ganun kadami.
Yes po.
O, ano ba naman yung 20? Ano ba naman yung 20 sa 9,000 na nire-review ninyo?
But
What is 20 sa 9,000 case rates? Ibig ko sabihin kung regardless of 10, ang pinangako mo, if you can make it 20, then maraming salamat po. Since sinabi nyo na 9,000 yung nire-review nyo na case rates, alam mo Mr. Ledesma,
po, can I just clarify something?
Parati po, kahapon, naging speaker po ako dun sa newborn screening society. Kailangan pa ba nilang lumapit sa akin para iparating sa inyo na hindi sila kasama rito sa case rates? Ba't kailangan pa nilang iparating sa akin? Pero naintindihan ko kayo, since sabi mo, 9,000 nga yung case rates na nire-review ninyo. So kulang yung panahon ninyo, pero nakikiusap na lang po ako sa inyo. Please, bilisan nyo na lang po since marami po ito. Kung kaya nyo ng 10 top 10 itong diseases, no? Killer diseases. O kung kaya nyo gawing 20, gawin nyo po. Sobra nga yung pera ninyo. May pera kayo eh. Ang problema, kung wala kayong pera, bumalik kayo dito, sabihin nyo sa mga senador na, sorry, wala kaming pera, hindi namin magawa ito, at hindi namin ma-increase ang case rates, hindi namin ma-expand ang benefit packages dahil wala kaming pondo. Pag sobra nga yung pondo ninyo, pwede nyong gamitin muna po ito. Ang question dito, nasa budget hearing po tayo, you are asking for the approval of the 74 billion ng PhilHealth. Nandiyan pa nga po yung 500 billion na reserve fund ninyo. Ang pakiusap ko lang po sa inyo, sir, alang-alang na lang po sa mga kababayan nating mahirap. Please, mag-isip pa kayo ng mga benefit packages in accordance with our existing laws. Kung kaya naman, legal naman, gawin nyo na lang po. Gawin nyo na lang po. Alang-alang na lang sa mga kababayan nating mahirap. Ako na po nakikiusap sa inyo. Bumababa po ako. Alam ko yung nararamdaman at paghihirap po ng taong bayan. Tinanong nga kita, pumunta ka ba sa mga ospital? Binisita mo ba? Hindi mo alam. Sabi ko, nagkasakit ka na ba no? Na-avail mo? Hindi. hindi mo na-experience ang paghihirap ng Pilipino. Marami naman po kayo dyan. Maraming experts dyan. Konsultahin niyo po. Ang dami pang sakit na pwede ninyong i-cover. Ang dami pang benefit packages na pwede ninyong i-expand. Ang dami pa pong case rates na pwede ninyong i-review para gamitin niyo po yung pondo ng PhilHealth. Kasi kami naman po dito, kami lang po nag-a-approve ng inyong budget at na-discover nga namin na humihingi kayo ng 74 billion na subsidy for 2025, then andyan pa po yung pondo niya na reserve fund na 500 billion. Unfair naman po yun sa mga ordinaryong mamamayang Pilipino na hindi po makalabas sa ospital dahil po sa kahirapan. Yung mga iba dyan, ayaw na pong magpa-hospital, ayaw na pong magpa-check up. Totoo po yan. Bakit? Takot po sila sa babayarin sa ospital. Kung alam lang nila, may sobra pang pondo ang PhilHealth na pwede nilang i-avail dahil lahat naman po ng Pilipino ay membro po ng PhilHealth.
Thank you, Madam Chair, if I may reply. Thank you, Senator Go. Duly noted on all your valuable comments, no. Just wanted to clarify, Madam Chair, just one issue, no. Senator, when I mentioned the top 10 most common diseases, these top 10 diseases, Senator, represents almost 80% of the total 9,000. So, kahit 10 lang siya po, representing na yan majority, no? Actually, close to 80%. So, by adjusting the top 10, parang almost across the board na rin yan po kasi halos lahat na rin yan po. But anyway, regardless, duly noted po on your valued comments. We will look into all of them and address them po. Maraming salamat po, Madam Chair.
Salamat po at pakiusap ko sa iyo. Under oath ka nung mga committee hearings natin. Tuparin niyo po yung pangako ninyo. Please lang po. Di ba narinig ko, sinabi mo, I promise, I promise, I promise. Tuparin niyo po yung pangako ninyo.
Madam Chair, if I can add one thing, no? Senator, to show you talaga na we really mean well and we're very sincere. In fact, pinagsabihan nga po ako kasi ang policy talaga ng PhilHealth, it has to go through the BENCOM before I can commit anything, no? So in fact, I'm actually, by committing to you, I'm actually breaking policy, no? So the reason I mentioned this, it shows how sincere we are in trying to deliver to the honorable committee, no? So I just want to assure you po, no? Kasi yung ginagawa ko, actually hindi talaga pwede yan kasi ang polisiya namin dapat lumusot muna sa BENCOM, no? Which is
Naintindihan kita kasi may board nga po kayo, di ba? May execom po kayo.
Exactly. Senator,
Diba?
buti na lang mabait yung
Oo.
chairman of the board namin kasi if not, kasi talaga I'm breaking policy po by
Sino
committee.
chairman of the board ninyo?
Honorable DOH Secretary Ted Herbosa po.
Oh, naiba na yung ihip ng hangin mo ngayon. Anyway, salamat sa inyo kung nagkaintindihan naman kayo, no? Para naman po ito sa mga mahirap nating kababayan. Naintindihan kita sa trabaho mo, Mr. Ledesma. Naintindihan po kita, Secretary Ted, sa inyong trabaho bilang Secretary of Health at bilang chairman po ng Board of Directors.
He chairs Mr. Secretary chairs the Board of Directors and chairs the BENCOM, which is the Benefits Committee po,
Okay.
that approves all of these benefit
Dapat nga,
packages.
you should complement each other kasi makakatulong kung tumaas yung mga case rates, expand yung benefit packages, ay makakatulong po, mas mabawasan ang problema ng mga pasyente. So it will unburden the medical assistance for indigent patients. No? Magtulungan po kayo. Alam ko, ang trabaho mo, kailangan ng approval ng board. Pero may tanong ako sa iyo. Bakit itong single period of confinement policy, 2013, bakit hindi nyo naisipang tanggalin noon? Bakit kailangan pa madiscover natin sa committee na dapat tanggalin na yung pulisiyang yan?
Actually, Madam Chair, kapapasok ko lang po ng PhilHealth eh. I entered po late 2022.
Why it took you 11 years na para tanggalin po yun? Kindly review your policy. Tingnan nyo po yung mga pulisya ninyo na naayon na po sa ating panahon ngayon. yung itong 24 hours na emergency confinement policy. Sabi nga ni Attorney Eli Santos, dahil po ito inimplement nyo dahil sa mga fraudulent claims no before, di ba? Am I correct, Attorney Santos? But now, nasa bagong teknolohiya na po tayo. I'm sure meron na kayong pwedeng gawin na maiwasan po ito. Sabi ko nga, sino bang Pilipino ang lokohin yung sarili niya, magpa-admit siya ng 24 hours para makaklaim? Marami na tayong bagong teknolohiya na naayon po sa panahon ngayon. Pag-aralan nyo po ng mabuti yan. Alam ko na may board kayo. Tulad rin sa amin dito. This is a collegial body. Di naman po isa lang nag-approve dito. Buong Senado po. Ganun din po yung sa inyo, naintindihan ko. Pero kung pag-usapan ninyo mabuti, review nyo, mas marami pa kayong mababago para sa ating mga kababayang Pilipino.
Actually, Mr. Chair, I just wanted to explain the policy, but clearly, without a doubt po, very supportive po yung chairman of the board and yung vice chairman of the board. We're very supportive to this honorable committee. I just wanted to clarify that. No, that's why before I mention anything or promise anything, kailangan kasi ang policy namin is kailangan lumusot muna sa kailangan ma-approve muna sa BEDCOM before I say anything. Yun lang po, diba? But duly noted on everything you're saying. And lastly, Madam Chair, if you're saying that we should work closely together with DOH. Actually, just yesterday po, if I may share, we had a very nice meeting with SecTed and he gave me a laundry list of suggestions on PhilHealth which are all very good, which we intend to implement po. Maraming salamat po, Madam Chair.
That's very good. Para hindi na kayo magturuan. Thank you.
I'll resume. President Ledesma. So before Senator Bongo arrived, I had a similar question about the case rate increases, And Senator Bongo, for your info, I fully support your petition to PhilHealth to review expeditiously those case rate increases, but mindful of the COA findings that there has to be a basis for the increases. For all I know, baka double pa, 50% or even more pa ang kailangan, or even 100%. And we're here to support that because what we want to avoid, and it is also based on Philippine Statistics Authority data, that Filipinos are spending for their out-of-pocket expenses on their hospitalization costs at 44% of the total health expenditure. So meaning to say roughly what, 55% is covered by PhilHealth, and then 44% is out of pocket. That's what Philippine Statistics Authority says. Is it similar to your findings? But of course it depends, Again, it depends on the case. So let the record show that you are agreeing with me that it is case to case. So if we go back to your and I think I can call it an agreement or understanding with Senator Bongo that you will focus on the top diseases or the top medical conditions, which basically covers 80 to 90% of the population, because kaya nga siya top dahil yun yung madalas na nangyayari. Then maybe what will give us comfort is if you can also give us a report that shows that for the current case rates and for your suggested increased case rates, what now will be the out-of-pocket expense? We want it close to zero, diba? Because again, I will repeat, when I first became a senator as early as 2004, the findings were, and we've come a long way, the findings were many Filipinos were not even availing of hospitalization because wala naman silang ilalabas. Kasi at that time, 2004, that's 20 years ago, most of the expenses tended to be out of pocket because it was only those who could afford who were availing of the services. Dahil wala naman out of pocket ni 1,000 piso ang mga mahihirap. So that's why our goal really was for your case rates to cover all of their expenses. So that's what we'd like. If you have that, if you have anything to share now, please do so, because otherwise we still have to review it anyway before plenary. Do you have anything to share? Like, what is the current case rate for, let's say, 1 or 2 or 3 diseases, and what is the percentage of out of pocket? Kasi the data I presented is obviously an average.
Madam Chair, thank you for your question. Actually, Madam Chair, we will show you something, but before I show you, Madam Chair, can I have your permission to I just want to read something. This is from the PhilHealth circular, no? It explains how the enhancement of case rates works. It's very short, Madam Chair. If I can just read it to explain to the committee and to the honorable members on how it works, no? Because it's explained very well here, Madam Chair, no? So this is a circular to all accredited health facilities, no? I'll just read the portion, Madam Chair. In enhancing the case rates, PhilHealth issued PhilHealth Circular PC number 2023-0025, providing the guiding principles of the rationalized inpatient case rates. Through PhilHealth Board Resolution number 2802, 2023, resolution approving rationalization of selected case rates and expansion of case rates for pneumonia and acute stroke. PhilHealth adjusted and rationalized select case rates. Additionally, through PBR number 2871, year 2024, a resolution adopting a 30% inflation adjustment factor for select case rates. The board approved an inflation adjustment factor of 30% for existing case rates to account for price changes over the past decade. I think, ma'am, to put this into words, no, what happened was it's been more than 10 years. It's been more than 10 years that the benefit packages have been enhanced. So even if we just put, let's say, a 5% inflation per year, that would be already 50%. So I think what the board decided is 30% would be a conservative number. They felt that it was okay because if you just look at the inflation adjusted of 5%, that would already be 50, no? But
Can you explain that to COA? Kasi hindi na naintindihan ni COA kung ano yung basis nun, di ba?
we will explain it to COA, ma'am.
And what you're about to say now is this is on top of individually examining every case to see what other adjustments need to be made, because that was just inflationary,
Yes, ma'am.
correct?
Yes, ma'am. And then, ma'am, so in line with that, thank you very much, ma'am, for allowing me to share this. In line with that, we can give you some data on
Yeah.
select case rates.
I'm looking at the same thing. So I have the same thing here. So we take note and be sure that you explain this properly to Senator Bongo that, for example, in the case of high-risk pneumonia, it's even 182% increase, but also to COA. Diba? Kasi nga there's a misunderstanding that it's just a 30%.
Yeah.
And then itong acute stroke is 171%. So it's more than 50%. It's more than 100%. Acute stroke, dalawang
Good.
klase, 171%. Another one is 111%. Yung hemodialysis, yan yung medyo maliit lang, 8%. But what you did here is you increased the number of sessions. That's what happened. And then the Z package is as high as 134%. Okay. Noted.
Yeah.
Noted on that.
Thank you very much, ma'am. And ma'am, again, with your permission, just one last thing. Our SVP for Finance just wants to add
Sige.
a few issues.
Wait lang, I just want to also add something. When you say that you will focus on, did you say top 10 or top 20?
The top 10,
Okay,
ma'am,
top 10.
Madam Chair.
And these are the top 10 common, right? Yung paulit-ulit.
Top 10 most common diseases by mortality and morbidity,
Okay.
ma'am. And sorry, ma'am, the top 10 represents, these top 10 cases represents 80%, almost 80% of the total 9,000 case packages,
Correct.
ma'am.
Okay.
Thank you, ma'am.
But what I also wanted you to take a look at, what is staggering for many people, and I don't think they fall into that 10%, are like heart transplant, and I know you have our experts here, the executive directors of our specialty hospitals, no? Yung sa kanilang mga ospital, yun yung mga medyo may mga sobrang costly na mga operations, right? So yung mga heart operations, yung mga kidney transplants, what kind of interventions do we have? Because I don't think they are part of the top 10, right? They're not. Pero umaabot ng millions yung mga procedures na yan. And so the impact on those individuals are really high. So I feel like there must be a separate treatment for these kind of conditions. Kasi it's one thing, kunyari itong package mo ng pneumonia, 90,000, okay? So before you increased it, binigyan mo ng 32, di maghahanap ngayon ng ng pang-cover yung patient sa billing ng hospital niya somewhere in the amount of 60,000, right? Based on the new and the old. So that means some hospitals maybe ang total charge nila is 70, some are 100. So somewhere there. So yung bubuuin niya is malaki pa rin para sa isang mahirap, 50,000, 60,000. Pero yung 1 million, staggering naman talaga even for middle class earner. So that's the kind of special study I'd like you to do because staggering like hindi nila mailapit kahit siguro 10, kahit sa malasakit center ang hirap na mabuo yung amount nila, ubos ka agad yon, and then pumunta man sila sa mayor nila or kung sino pa mang tumutulong, hindi mabubuo yung amount na yun. So how do we help in those cases?
Duly noted, ma'am. Ma'am, I just want to add, and it's good you mentioned it earlier. We have a benefit package for open heart surgery,
Okay.
which will be implemented on or before December this year.
Okay.
So
How much
actually,
is
in
that,
fact,
out of curiosity?
ma'am, we have a list of a number that will be implemented in December. For the details, ma'am, can I ask? Okay, can you ask this question? COO will address your question.
Madam Chairperson, if I may.
And
So,
pakidagdag na rin doon yung question ko kanina, yung COA findings then on the reproductive health commitments under the law, no? May requirements din yon. So are you also in the process of studying, rolling out reproductive health related?
Madam Chairperson, as to the COA findings, we are still trying to find it, Madam Chairperson, because at present we don't have it. Probably we can. Yes, Madam Chairperson, we're trying to retrieve the COA findings, Madam Chairperson, please. Thank you very much for that, Madam Chairperson, please. And going back, Madam Chairperson, if I may,
Wala kayo nun?
we're looking at which COA findings, Madam Chairperson. Is it
2023. Anyway, I'll give you a copy.
Thank you for that, Madam Chairperson. So going back to the question earlier, Madam Chairperson, on the open heart surgeries for tetralogy of Fallot, ventricular septal defect, and coronary artery bypass graft, this is due for December this year. However, as to the details, we don't have it yet, Madam Chairperson, but this is an enhancement, Madam Chairperson, of the present case rates. And as to the cost, Madam Chairperson,
Curious, do you have it? What is the correct
no, Madam
case rate?
Chairperson, not yet.
Sige. Sabi mo, this is an enhancement.
Yes,
So,
Madam
what is
Chairperson.
the existing?
We'll provide it to you later, Madam Chairperson, please, if I may.
We'll
Sige,
just pull it out, Madam Chair.
sige,
In
sa
just a few
sa
seconds.
reproductive health then, please.
Yes, Madam Chairperson.
What packages do you have available aside from breast cancer? Secretary Herbosa, this is where, I'd like to ask you as the chairman of PhilHealth and then as DOH secretary, that when you told me earlier that you will now have HPV vaccines being rolled out, then you also have a system where you're tracking that such that 10, 20, 30, 40 years from now, sana close to existence na yung cervical cancer, di ba? Yun talaga yung gusto natin nakikita as a result of all this. And then going back to your newly hired promotions director, yung campaign nyo against smoking and vapes and e-cigs, which you have told me is also a priority of yours, then we will also, well, for lung cancer, dapat bumaba yun. And then I think for the time, for a while, we probably will see a increase in EVALI related because it's on the rise. But then when we are able to educate the youth about it, then sana it doesn't go up. No?
Yes, Madam Chair. In fact, for Ivali, we have a first death
I know
reported in
exactly.
Philippine General
I think
Hospital.
we covered, we had that
Correct.
in my budget, in my not budget, in a Blue Ribbon hearing. We had that information was made of record. Okay.
Madam Chairperson, if I may. Madam
Go ahead,
Chairperson.
Attorney Santos.
Madam Chairperson, the present case rate for coronary artery bypass graft surgery is 550,000 pesos, Madam Chairperson. And for the surgery for tetralogy of Fallot in children, it's 320,000 pesos, Madam Chairperson. And for surgery for ventricular septal defect in children, it's 250,000 pesos, Madam Chairperson. Please, and as committed earlier by our President and CEO, Sir Mandy Ledesma, we're going to increase these packages sometime in December 2024, Madam Chairperson. Thank you very much.
This thing which are about to increase, right?
Yes,
Don't
Madam
say-
Chairperson.
Yeah, okay. So President Aventura, do you have at your disposal right now the current cost of the procedures that Attorney Santos mentioned? So we can already use it as a point of comparison.
Yes, opo, ma'am. Well, our Z benefit package, what Attorney Santos was referring to was, for example, the cabbage package for Z benefit one, PhilHealth would give us 550, and the 550 is actually for the operation itself. 440 is for the operation itself, and 110 for sort of like the professional fee that is actually given to the staff of the heart center,
The team.
not just the team, but the whole hospital.
Okay, okay.
Yes. And then
Okay.
on top of that, if you have the PF itself, we have a range from 150 to 250 to 350. That's for the professional fees that will be divided for, of the surgeons, the anesthesiologists, and the intensivists, and all that sort. So that would be how we do it in the heart center. But let's say in a different institution, for example, a private institution, you could have the PF twice as much as the 550. So you can have 550 for PF.
Yeah. So before we go there, no, to the comparison. So, you're basically saying that the Z package that is currently in place would only cover the operation itself, and then the second item was the staff.
The PF or yeah, PF.
Sabi mo iba pa yung PFs dun sa staff.
Yeah, for the staff of the whole hospital, yun yung 110.
Kaya
That's
nga.
yes.
So but what would your charge to the patient be?
Just
Roughly.
the patient would pay, for example, if it's an NBB or no balance billing patient or a QFS patient, he would not pay anything else more unless it's a pay patient that he can have 150, 250, or 350. What do you call that? Copay for PF.
So roughly yun yung copay.
Yeah po.
Dapat yung mga billing na nakakarating sa akin, mabot ng 1,900,000.
Iba naman ho yata yun. Kasi Z benefit package is for those
Or I think some of it includes lengthy hospital stays.
yes,
and
most
then
probably.
Everything adds up, 'di ba? O yung ICU, yeah.
Yes, this is for standard risk po. Standard risk cases that we don't want any complications.
Okay. Sige, I just wanted to understand it better. So maybe
Chair,
yes.
may mention na I'd like to elucidate further yung what we call QFS. QFS is quantified free service. So in all the DOH hospitals, what PhilHealth gives and what GAA and PS and all the budget of government gives, kuminsan kulang pa rin. So we're able to still provide no balance billing to the indigent from QFS. QFS comes from revenue. Kasi in the early 90s, nagkaroon ng fiscal autonomy ang mga DOH hospitals so that any extra revenue is actually kept in the funds of all our hospitals. And that's what we use for quantified free service. So that's why we're able to give parang universal healthcare na. Basta poor ka, we actually have access to all these operations. And then yung free service part, dun kinukuha sa revenue na kinikita nila from the other patients.
Means why those who usually come to us now with those huge balances tend to be middle class.
And that's
They
the
tend to be
problem.
middle class, and that's why in a totally different bill that I was working on, it wasn't even health related. I sought to redefine, not really redefine the definition of indigent, because indigent is indigent, but
Correct.
really define who is needy, because on a case-to-case basis, there's a lot of middle class
Correct.
families would still be needy if the hospital bill is even 200,000, 300,000.
Yes, Madam Chair. Remember, our clients at the Philippine Heart Center are regular government employees, the
Mm.
soldier, the policeman, the teacher, the government employees in the center.
Yeah, and
So
they,
they
and
are
they
middle
have
class.
income. They have
They have
income
income
that can give them a decent life until
until they get a heart
disaster
attack. Yes.
disaster hits.
So ito ma'am yung problem ko ngayon sa universal healthcare. Kasi technically, universal healthcare tayo sa poor. Pag ikaw na-classify as indigent, zero talaga babayaran mo. You can get the operations covered by all of this. My problem is how will I bring universal healthcare to this middle class? Ito yung problema ko ngayon. Ito yung, can we make them zero? Ang thinking ko hindi eh. There will always be a copay. Kasi pag libre lahat, in other countries, they become careless. Like in the Middle East, they damage themselves. They're obese. They don't take care of the diet. The things we're talking about earlier in your opening statement. We also want a certain level of wellness that the people will take care of themselves. And Singapore did this. They charge you higher if you are not healthy. Parang meron kang copay na mas mataas kung hindi mo mine-maintain yung health mo. Kung hindi ka nag-take ng anti-hypertensive, anti-diabetes. Kasi eventually, you'll end up with acute intensive care in the hospital. That's very expensive. So parang ganun yung balancing act nila. That's, I think, where we eventually will move our health system to. How do I protect the middle class? Ito yung human capital natin sa Philippines. This is the one creating income and taxes. Yet they're the ones we are now having inequity. Dati ang inequity problem natin are the poorest. But now, with MAIP, with PhilHealth, covered sila, basta indigent ka. But the near poor ang tawag ko dito eh. Middle class sila, they have income, it's enough for having a family, but it's not enough the moment you have a catastrophic illness.
As you know, my father had a liver transplant in the US because it wasn't available here, and catastrophic talaga yon financially, which is why health became my advocacy. Okay, thank you. Wait, I did have a clarification. Yeah. So Dr. Aventura was included in his initial response about how different hospitals have different treatments, no? And I wanted to actually pose that question to you. That's why I said, let's not go there yet, because I have actually the same question in mind. I understand that the distribution of syntax proceeds are different per hospital. The sharing for the professionals.
No, this is the PhilHealth. Baka not
Or the PhilHealth, sorry.
The PhilHealth has
Yeah.
a part of their reimbursement. For example, a case rate. Part of it is supposed to be professional fee.
Okay.
Now, when the case rate was formed, it was supposed to be only for the doctors because the professional fee is only for the doctors.
Yes.
But in the past, prior to this case rate development, the PhilHealth was so small that the physician said, bigay na lang sa mga nurses yan. Kasi mababa naman yung nurses. So
Okay.
dinivide nila into a pool.
Okay.
So like at PGH, we actually pool
Yes.
all our professional fees from the charity patients
Yes.
na binigay ng PhilHealth. At dinidivide yon equally. Now, if you're a 1,000-bed hospital with very many employees, ang liit na lang yung nakukuha nila. But when you're let's say 100-bed hospital with very few physicians and nurses, malaki yun. It actually goes up to as high as 100,000 a month in terms of their hati-hatian. So na-incentivize naman in the smaller hospitals kasi dati they dump the patients to the big hospitals where
Yeah.
there are more personnel. But because of this incentive, ginagawa na nila yung appendectomy, yung mga
Yeah.
simple na
And
kaya
I-
nila, which is good.
And I appreciated it because it keeps our health workers in the country because they're earning more now.
Correct. It's an addition to their salary.
Okay,
So may
but-
salary niya sa government,
Yeah.
may PhilHealth professional fee share pa sila.
Okay.
PhilHealth share ang tawag nila
Pero
doon.
yun nga, is the treatment different in
Yes.
different hospitals?
Unfortunately, it's dependent on what the director or the
So,
Execom,
but
Mancom of each
something
hospital
that you
does.
can study because of,
Tama.
I mean, I guess that's why I direct my question more to you as Secretary of Health, because you're privy to the info as PhilHealth chairman, but you're also privy to this as a Secretary of Health. Na if one system is better than the other, can't you correct that by way of an administrative order or persuasive positioning that yourself in that discussion?
Yes, Madam Chair. We
Probably
actually,
not easy.
I've been
but-
looking at it. There are some, like for example, there are some governors who have very imaginative or innovative ways of
Ano yung
dividing it.
pinaka-okay?
Merong minentain niya, may share siya sa nurses and staff, may share siya sa doctors, and may share siya for the hospital. So yun ang
Yeah.
nakita kong
Equitable, I was gonna say.
pinaka-equitable.
Yeah.
Kasi nga, at least lahat ng tumulong to
Everybody.
take care of the
Yeah.
patient, may
From the
konting nakuha.
from the moment dumating yan sa emergency room
Correct,
or
correct.
sinundo ng
Correct.
ambulance.
Oo. So parang
Correct.
pooled income, parang they're both a team and everybody gets a share depending on their input.
Okay.
We will study it. Sige, paaral ko, ma'am. I think that the direction will have to go to keep people incentivized. In the smaller hospitals, malaki yung ganyan, ma'am, yung sharing,
Yeah.
yung fill. Kasi mas konti silang nag-share.
Yes,
In the
exactly.
big DOH hospitals, parang 10-20,000 a month lang yung additional. Very minimal.
But
Pero
it's still
doon sa,
something.
it's still something.
What's the starting rate of a nurse now?
24,000.
Oh, plus 10.
Plus 10.
That's not bad at all.
Oo.
That's almost 50%.
Correct.
I-
Correct.
y-
correct.
You're just saying that it's much bigger pa in other hospitals.
Hindi
but
naman yun every month. Sometimes it's quarterly.
quarterly, yeah.
Depending on naipon na patients.
Correct.
So that's driven by, ang tawag doon, performance-based.
Yeah.
Kasi if you perform more, you do more operations, you do more admissions, taas yung
the
income.
hospital gets a reputation.
And the hospital
Na
gets it.
kahit public yan, hindi lang dahil mura pero magaling dyan.
Hindi
di ba?
tumatanggi. They
Yeah.
keep doing cases. Oo.
Yeah. Okay. Let me just
Madam Chair.
yes.
Madam Chair, Madam Chair, can we request permission just to briefly answer your question on the methodology of the computation for the case rates of COA? So basically, we've seen a copy already of the COA AOM. We've replied to COA. It's a very lengthy reply. So what we'll do is we'll furnish your good office a copy of that
Okay.
reply. But maybe, Madam Chair, if I can,
Gist,
in gist,
that's it.
yes, we'll submit it to you in full,
Yeah,
Madam Chair. But
That's the
now,
gist.
if I can give you, if I can be
Gist.
given a few minutes, yes. So basically, Madam Chair, in view of the foregoing, we recommend that PhilHealth Management conduct a comprehensive assessment of the methodology applied and to be applied in future case rate adjustments, including the data and factors to be considered to evaluate its effectiveness in accurately determining the adjustments to benefit packages and consider revisions or implement necessary corrective measures if warranted to uphold reasonableness in the adjustment process. To mention a little further, Madam Chair, the consideration for the adjustment are the following. Case rates have not been adjusted, as I mentioned earlier, since its implementation in 2013. Create goodwill to strengthen partnerships and encourage provider compliance and participation. Underspending on benefits resulted in increased reserves and lower budget allocations. Now, Madam Chair, for the budget estimation methodology, the first is the standard growth rate, SGR, was determined using a 3-year exponential moving average. Second, the applied rationalized rates adjustment for identified case rates for rationalization. Third, applied inflation adjustment factor based on the facility type on applicable case rates. Fourth, summed results. Fifth, computed difference between treatment and no treatment estimates. And lastly, conducted sensitivity analysis to enable willingness to pay, Madam Chair. So I hope that clarifies it,
Yeah.
Madam Chair, and we'll furnish your good office immediately our complete reply to COA, Madam Chair. Thank you very much, Madam Chair.
But I'd like to see your reply to all the different observations of COA.
Yes,
Just
Madam
for
Chair.
that one.
Yes,
Yeah.
Madam Chair. We will furnish you a detailed reply on each one, Madam Chair.
A response on the observation reproductive health implementation of reproductive health related procedures? Because that was also one of the observations.
Just give us a few seconds, Madam Chair.
Okay,
We
sige.
will reply. Thank you, Madam Chair.
To add anything, because if there's no other senators that arrive, I will be ready to end this hearing soon.
Yeah, maybe just for information of the committee, kasi kanina tinanong ni, sayang umalis na si Senator Go, but I wanted to add yung specialty centers. So there are planned 349 specialty centers na na-designate all over the country. 158 have been completed. So ito yung mga heart operations, kidney centers, and cancer centers na na-build na.
These
In the
you
DOH
talking about
hospitals.
new specialty centers attached to the
Attached to the regional hospitals.
Okay.
Yun yung tinanong niya kanina. So for the 2025, we allocated 3.5 billion, 3.6 billion pesos. And that's distributed in all the regions to complete yung mga specialty centers. At yung 2024, meron din kaming listing. We can submit to you a listing of all these specialty centers. The beauty of this is the order of the president to us to make sure na yung mga taga-probinsya maasikaso na sila
Yeah.
in the regions
Yes.
for open heart. So I just visited the Cagayan de Oro, Northern Mindanao Regional Medical Center,
Mhm.
and yun yung isa sa pinakaunang ginawa, yung Heart Lung Kidney Center doon sa Cagayan de Oro. And it's doing a lot of operations, parang 400 a year na heart, parang self-sustained na sila. We have one in Cotabato and Amay Pakpak, pinupuntahan pa siya ng heart center. Tinutulungan siya ng heart center para after a while, they become standalone. So ganun, yung standalone na sa Mindanao is SPMC, yung Southern Philippines,
Yeah.
at yung sa Cagayan de Oro. And then sa Cebu, meron din kami. So all these mga big operating specialty centers na tatayo. And then there are 7. Ito yung legacy projects of the president in different parts of the country. Yung cancer center, meron sa Bicol, meron sa North. So this will all improve the whole healthcare system.
Okay.
Yun lang, madam.
Okay. Nutrition Council. Nandiyan ba? But nandiyan kanina, di ba? Baka nag-step out lang.
Madam Chair.
Yes.
Madam Chair, sorry. On the COA findings for reproductive health, Madam Chair, can we just, because we can't seem to find it now, can we just send it to your office po, the COA findings on the reproductive health po? Yes, ma'am, including our response. Yes, ma'am. Thank you, ma'am.
Kanina si executive, is it executive director ba yung title niya? Dayang Hirang. Did she leave?
Madam Chair, my project also is on nutrition, and we have 2 big projects. Yung sa government funded, that's the Tutok Kainan, implemented by the National Nutrition Council, trying to target yung feeding programs
Right,
for.
yes.
And then there's also the Philippine Multi-Sectoral Nutrition Program together with DSWD. This is a loan from the World Bank. This is really to lower the stunting, the rate of stunting in the Philippines. This same project has actually been successful in Indonesia. So we're implementing this. We're trying to digitize everything so we know all where the stunted and malnourished kids are, focusing on the first 1,000 days, focusing on micronutrients, the folic acid, the nutrients, and then making sure that development goes on. And then tutuloy namin to with the DepEd. Ito yung school age feeding program. As of now, even in Malacanang, we discussed this. The biggest bulk of the money is in the school age feeding program.
Yeah.
Kasi ganun ang nangyari. But now they're trying to swing some of it to the first 1,000 days. Because the first
Exactly.
1,000 days is the most critical
Yeah.
because of brain development. We'll end up with a generation of stunted children at
But
20
the first 180 of those 1,000 days
Is
is
in-
more breastfeeding.
in
I'm
the-
sorry.
is
No.
maternal, is pregnancy.
Yeah, the after the 9 months,
Intrauterine,
after
yeah.
the 9 months,
Yes.
it's the breastfeeding year.
Correct.
So
Lactation, intrauterine,
Yeah.
lactating mother, and then up to 1 year. 2 years ang 1,000 days.
anyway, we understand each other, but I wanted to focus on its implementation. But yeah, where is
Ma'am, andito si
No, she was here
Yusek
kanina,
Balboa.
di ba? No, but where's the Nutrition Council director?
I don't know, but I have
But yeah,
Undersecretary
that's
Balboa in
it's
charge of
okay.
my.
I just want to know where she is though, because did she just step out or somebody should know? Does she have staff here? She was never here. O, di suspend ko na lang yung budget niya. Bakit naman wala? Suspend ko yung budget niya. Eh, you should all be here. I called the name. Sana somebody had the courtesy of telling me na not here, may sakit ba or what. I'm more than happy to hear from your USEC, but I expect all the heads to be here because I don't know who will ask questions. It just so happened I have questions for Nutrition Council. So hindi ko i-consider yung budget if there's nobody from their office. Kasi I feel like they have a very big role to play and it's not present. So kindly find out. Oo nga. So sabi ng staff ko nag-confirm daw sa kanila.
Madam Chair. Madam Chair,
Yes.
she confirmed daw, and according to our legislative liaison, he's out of the country and pabalik pa lang. I don't know.
Sinabi.
But there is a representative.
Ba't siya nag-confirm?
Hindi ko rin alam. Baka na-delay yung flight or something. We'll call the NNC
Sorry,
staff
Ng
who's on the
staff,
other.
reasonable naman.
Yeah,
So if
the
there's a
staff is on
reason,
the other
just
day.
tell us.
Sino yung staff? Sige. Sit down. Yan mo upuan. Dito.
No, but I don't want to talk to a staff. So no, don't bother na lang,
ba yun?
Secretary. I want you to talk to your executive director and find out
Di ba
why
may
she can't
deputy tayo?
inform us properly.
Sino yung deputy? Hindi pa nag-assume yung deputy. May
Mhm.
bagong deputy din. We just appointed a new deputy
Mm,
executive director of NNC.
Okay.
But
And
hasn't
wala
assumed
rin?
pala. Oo.
Hasn't
assumed.
assumed.
Nag-oath na sa
Sige,
akin
pero
yun.
in other hearings, hindi talaga tinitake up ang budget na wala dito yung head. So I don't know who's your official coordinator secretary. They should know that. You can't just not attend. Or you can't say, oh, I thought my flight would be there and I'll be there at 1. Even you didn't know. So what are we gonna do about it? It's just naman expecting due respect given to our hearing, di ba? Okay, let me just check on a few items before I decide on what to do about this. For PhilHealth, no? Remember we discussed earlier the increase in the budget for indirect contributions, right? You have a slide on that. It went up by, was it 30%?
33%, Madam Chair.
No? But I said what's lacking in that story, and I know you have I've seen the slide, so no need to present it, no? But what's lacking lang in for the public to understand is I asked you, so may shortage yung budgetary support for the indirect contributions, right? But it increased this year, correct? Okay. So
Correct, Madam Chair.
but what is still the gap? What is the unfunded amount? I have a number. I just want to confirm with you if it's correct.
Madam Chair, if you can just be given a few seconds, Madam Chair.
How do you difference?
Ito, 150 50 pa yung binigay kay Beth.
Ngayon,
Ito po
53.
is yung amount. Ito yung number.
Ito yung bago. Oo. Actually, I can answer it. Can you just confirm na lang?
97.65 billion, Madam Chair. I'm just making sure, Madam Chair. Yes.
No
Yeah.
problem. I don't mind.
Yeah.
But and so that people understand what we're talking about, the amount that you deemed necessary for indirect contributions for 25 million members is 150 billion. And then DBM allocated 53 billion, and that's why you still have a shortage of a shortfall of 97.5
0.65. Yes.
0.59, yeah, 97.6 billion. Is that correct?
Yes, Madam Chair.
So sorry to put you in this spot, but why would you give away 89 billion if you have a shortfall of 97 billion? And if you're going to answer me, para maiksi na lang to, are you going to answer me is because there's a GAA provision said that if it is not spent, you will give it back. Yun ba isasagot nyo sa akin?
Yes, ma'am. Yes, Madam Chair.
O, so bakit hindi nyo ginastos? Pwede tayong umupo dito at pwede kong tanungin sa lahat ng executive director ng ating specialty hospitals, pwede kong tawagin lahat ng USEC para sabihin sa akin ang listahan ng mga unmet needs ng patients natin.
Actually, Madam Chair, thank you very much for the good question. Kaya Madam Chair, that's why this year we're very aggressive. Naghahabol po kami, diba? Kasi we felt that maybe we should have started earlier, but it's past us. That's why we're being very aggressive this year with increasing the benefit packages, and we intend to be just as aggressive in the coming years, Madam Chair.
Yung board members nyo, how many of them were members prior to 2022?
Actually, Madam Chair, PhilHealth has a board membership composition of 15. I think 6 are ex officio, no? And if I'm not mistaken, Mr. Chair or anyone can please correct me if I'm wrong, almost all of them, almost all of the holdovers were already replaced. Parang isa na lang ata natitira. Mr. Chair, is that correct? I think it's just BM Padua who's left behind. So all of them, Madam Chair, are actually new members.
Anyway, the reason why I asked is because obviously if you're new, then you need some time to catch up. But I'm assuming that the persons appointed to that board are highly respectable individuals that know how to run a corporation, because you can't run the corporation on your own. So knowing that funding will not be there all the time is really the push that you need to roll out these packages. And I'm telling you, and I'll say it just one last time for this hearing, 2004 pa lang, most of these issues I have already heard, and they never really were resolved. So these case rates, pati yung mga change in policies that Senator Bongo is requesting, the only difference is since I've been around that long, I know the reasons, at least I remember the reasons given to me why such policies exist. But it's only after you implement that policy do you see the repercussions. So maraming ospital na nagkaroon ng lokohan dun sa nagkukunyari sila na maraming pasyenteng nag-avail ng services paulit-ulit. So nagkaroon ng what do you call that policy, yung once
Single period of confinement, Madam Chair.
Confinement. I was educating my staff na lahat naman yan may pinanggalingan na incident. And then you come up with a policy. The question is, does the policy solve the problem, or does it also create, maybe it solved that problem but created more problems? And it's part of growth. The important thing is it's addressed right away. So sadly, you come into a position, you come at a time where there are 10, 12, 15-year policies that are really high time for the review. And I think what most legislators expect, not just senators but also from the House, is that they see that you're proactive about addressing it. Because bago makarating sa legislator yon, most likely nakarating naman din yan sa DOH, sa mga ospital at sa PhilHealth. So parang when I have to bring up an issue, it's a little bit disappointing if kailangan pa namin banggitin para mahanapan ng solution. Yun lang naman yung gusto kong take away nyo dito. Okay? So I think there are no other senators coming. So because of the request of Senator Bongo for your compliance with his requests, and then I have a concern that there is a nutrition, the head of Nutrition Council is not present. I have no issue with all the others, but we require that these submissions are made on your part, PhilHealth. With Nutrition Council, please talk to the secretary and then just coordinate with my office kasi I have questions. So your budget is not officially deemed submitted, but it will be submitted once you comply with Senator Bongo's request. We have a few more days for you to comply. And I think there are some senators who have submitted some questions. So we will just give it to DOH for your proper response so that we can also prioritize your budgetary requests. I take note. I want to address each of the executive directors. All of your requests are duly noted, and rest assured, I have already approved in principle the top requests of each of your agencies. I fully support. If my team needs more details, they'll ask you, but some of them we just had to approve in phases kasi medyo malalaki. But we appreciate the work that you do, and we are submitting your request for approval.
Madam Chair.
Yes.
Sorry, Senator. Madam Chair, thank you very much for that. I wanted to ask you, is it okay if we put together within the day, or maybe now, we'll put it together, the commitment to Senator Bongo, and if it's clarified with him, can we submit it within?
I can suspend for a few minutes. I can go up to my office for a few minutes if you want to work on it with his agreement. It's up.
Yeah.
Let me.
Either way is also okay with us. It's just a suggestion. Thank you very much, Madam Chair.
Okay. So wag na lang. Okay. Okay, sige. So may sasabihin ka pa? Go.
Salamat, Madam Chair. Meron lang po akong pahabol sa DOH. Yung JAW po ng Secretary Ted, ilang months na po ito, napabalik-balik na po. For the record lang po, malaking tulong po itong JAW na ito dahil tutulong po ang DSWD sa medical assistance. Kasi for the information of my fellow kababayans, ang Malasakit Center po, 4 na ehensya yan. PhilHealth, PCSO, DOH at DSWD. Sa ngayon po, hindi makakatulong ang PCSO sa medical assistance. With this JAW, pwede na pong tumulong ang DSWD sa medical assistance. So let me repeat, no? Ang Malasakit Center, one-stop shop, 4 na ahensya ng gobyerno, PhilHealth, PCSO, DOH at DSWD. Sa ngayon po, ang tumutulong sa medical assistance ay ang PhilHealth, ang DOH through MAIP o MAIFIP, PCSO, konting tulong, at ang DSWD, pamasahe lang po tinutulong nila. Pero pag napirmahan po itong JAW, pwede na pong magbigay. Sila yung pinakahuling tumulong sa medical assistance para makatulong sa mga indigent patients sa kanilang pagpapa-hospital. Malaking tulong po ito, Secretary Ted, kung mapirmahan na po itong JAW na matagal na po nating pina-follow up na mapirmahan po.
Thank you, Mr. Chair. Napirmahan ko na po yung JAW, pero at PhilHealth yata napirmahan na rin. Nasa PCSO at DSWD. We're awaiting the return to and then we can implement it already.
Salamat. Naniniwala kayo na tulong rin po ito sa medical assistance. Naniniwala ka ba, Sected?
Yes, yes, Mr. Chair.
Medyo matagal na po ito. Last year pa po itong,
Tama
maalala ko, last year pa na hearing, I think,
Bumalik po.
2023.
Meron lang isang phrase na medyo hindi nagkaintindihan. Yun ang nagbalikan.
So, sa
within the
bawat
years.
araw na nadidelay po ito, ilang pasyente po ang pwede pang matulungan sana ng medical assistance through DSWD. Salamat po, kindly po.
Yes, gagawin po natin yan, Mr. Chair.
Yusek Berhere, kumusta po yung hospital sa Dagupan? Dahil sa pakikipagtulungan, no, alam ko na naipit kayo dito sa alam mo, pag napapasukan na po ng politika yung isang lugar, kawawa po yung mga proyekto ng gobyerno na dapat po mapapakinabangan ng mga pasyente, mga mahirap nating kababayan. Nagpopondo po kayo ng hospitals. Ang problema rito, hindi pa po na-implement. October na po. Sana wag ma-revert. Kumusta na po ito?
Yes, good afternoon po, Madam Chair and Senator Bongo. I went there yesterday and was able to convene a meeting between the city mayor and the city councilors of Dagupan City. And finally, they have agreed that they're going to use the lot that was proposed by the councilors. But the only condition was the mayor doesn't want any demolitions that will be undertaken. So they found a lot which is appropriate for a level 1 hospital in the area of the proposed lot by the councilor. So tuloy na po, Senator Bong, ngayong umaga po nag-session yung councilors. They were able to pass the resolution both for the memorandum of agreement to enter for us to download the funds to the city of Dagupan, and also the resolution for them to apply for the permit to construct of the hospital. The only issue now, Senator Bong and Madam Chair, if we can be able to meet that deadline of DBM as to the fund use and the downloading of funds, dapat yata po hanggang end of October lang. So binibilisan ho namin lahat ng proseso.
Salamat po, kindly po, Yusek Berhere. Alam ko nakatuto kayo rito. Sayang naman kung ma-revert yung pondo. At sa HPEP in charge, nung nakaraan taon po, isinulong natin na mapondohan po itong Rojas Memorial Provincial Hospital sa ilalim ng HPEP. Hanggang ngayon, di pa rin ito natatapos. Mayroon pong 90 million para sa completion nito ng 2024, pero ayon po sa LGU, kailangan pa po ng about 400 million. Kumusta na po ito? At ayaw natin maging white elephant po ito. Yung pakiusap ko sa ating HPEP in charge sa DOH na wag po maging white elephant at maging fully operational. Importante, mapakinabangan po ito. Mas problema tayo kung nakatiwangwang yung hospital dyan at hindi nagagamit. Mas mabubulok po kung hindi siya maging operational.
Madam Chair, nagpunta na po yung aking Undersecretary for Visayas, si Undersecretary Maestral. Nakausap namin yung governor at meron na kaming mga solusyon para mapatakbo yung para mapa-under yung bidding. Visayas siya in charge. Maestral, ito.
Ito si Yusek Maestral, in charge ng Visayas. Kabisado to, taga Longgo to. Kabisado niya yung mga problema nga to sa aton. Salamat, Gid. Yun lang po, Secretary. Pakicheck lang po yung mga super health centers na maging operational at hindi maging white elephant tulad nung nireport sa Kandihay, sa Bohol. Nagkaroon ng problema. Kaya, huwag nyo na po antayin na dumaan pa sa committee yung pagko-call ng attention para matapos po. I'm sure, alam po ng inyong mga regional offices yan kung anong kakulangan and to make it operational. Malaking tulong po yun kung matapos at mapakinabangan po ng PhilHealth through their konsulta program. At salamat, no? Tinaasan nyo ang konsulta program from 500 to 1.7. Paki-inform lang po ang inyong mga LGUs na dapat magpa-accredit rin po sila. Malaking tulong po yun. Dahil membro nga lahat ng Pilipino, membro po ng PhilHealth. Hindi lang nila alam kung saan sila magpapa-check up at magpapa-accredit. Napakahalaga po yung information campaign po ninyo. Salamat, Secretary. Salamat, President Ledesma. Madam Chair, maraming salamat po.
I do have a question on your Consulta rollout. For around 3 or 4 years, so even before you became president, I've been informed that there was a year, and this involves you also, Secretary. There was a year that the Secretary of Health actually DOH was asking for, I can't remember how many billions for the rollout of Consulta. And then we advised them to do some pilot projects first. And then they agreed, pero there was already a big request. And then the next 2 years, parang nandun pa rin sila sa pilot. So, nasa na tayo ngayon sa Consulta rollout?
Actually, Madam Chair, we are no longer in the pilot stage. Consulta now is fully implemented. It's an ongoing program.
What happened to the pilots? Were there results? Kasi I'm very interested in it, and I wanted to. We advised. It was our advice. I don't know who else advised, but I can say that the Senate, I personally advised that they do a pilot area. They do pilot areas first. So I want to know the results of those pilot areas.
Madam Chairperson, if I may.
Yes.
Madam Chairperson, we will submit the result of the studies conducted for the pilot implementation of the Consulta. But at present, Madam Chair, to reiterate, we are already implementing the regular Consulta program as a full-blown program, Madam Chairperson. Although there are still part of the comprehensive outpatient benefit package, which is still on a pilot implementation. But we
There
have
are
this.
some components that are being fully implemented.
Yes, Madam Chairperson.
Can you explain a little bit? I just heard it in passing in your presentation, President Ledesma.
Madam Chairperson, if I may.
Kasi in your presentation, it says pilot implementation. So ano bang ibig sabihin nun?
Yes, sir.
Madam Chair, so as of August, Madam Chair, as of August 31, 2024, there are currently 2,943 registered facilities, no? 2,541 are government, 402 are private, no? And then, Madam Chair, for first patient encounters, there are 14.4 million. And then also as of August 31, Madam Chair, registered for the Consulta program is 24.67 million. For membership, there is 17.68 million. And for dependents, members 17.68 million, and the dependents are 6.98 million, Madam Chair. I hope this is helpful, Madam Chair.
Yeah, so baka hindi lang na-update yung presentation nyo because it says pilot. Pero from the way you're telling me, I would already call that a partial implementation.
Yes, Madam Chair. Our apologies. So our presentation was not updated, Madam Chair.
Okay.
Apologies, Madam Chair.
Sige. And what is the budget now for Consulta?
30 billion, Madam Chair. For 2024, Madam Chair.
And that was provided na in the NEP.
Can you appeal? On the COB, Madam Chair, can you?
So what budget was granted to you in the NEP for Consulta, and what other sources of funding do you have for Consulta?
Madam Chair, if may I. The budget for the Consulta, Madam Chair, as embodied in our corporate operating budget in the year 2024, as mentioned.
Sorry, it is incorporated in your
corporate operating budget, Madam Chair, COB of the corporation. That is at 30 billion, Madam Chair.
Go ahead.
Yes, Madam Chair.
And how much does it come out per person?
Madam Chair, the
How much
allocation,
yeah, go ahead.
the budget actually, Madam Chair, as embodied in our latest circular, per individual is 1,700 pesos
Mm.
for our regular consulta program, Madam Chair. So meaning if we're gonna divide 30 billion by 1/7, can you get a figure, please?
Madam Chair, just want to highlight that the capitation rates are currently at 1,700, but previously it was 500 pesos for public and 750 for private. And now it's been increased to 1,700. Just wanted to mention that to this committee.
That's why I wanted to know the outcomes of the pilot studies, because different areas had different capitation. So I wanted to see what was the effect of that. How like obviously and this goes back to my advocacy na if yung LGU na yon masigasig ang mayor working very closely with Department of Health on healthy living, etc., then there's a big chance na mababa lang ang ano nila, ang cost nila, di ba? Ganun yun naman talaga yon. So that's what I wanted to see. And I wanted to be sure that included in your rollout is also the feedback mechanism, the repertorials that you need to see para makita nyo kung saan yung mataas, saan yung mababa, kung merong may kalokohan. Let's not pretend na walang magbabalak, meron din siguro. Kasi kung magaling di ba the way that works is you give, let's add a little bit of detail so that the public that's listening can understand. The way that works is you give a lump sum to your participating health facility, correct? And if they manage their population properly, kumbaga sa umpisa pa lang, yung mga nanay nagpapa-breastfeed, pinapa-immunize yung mga bata, yung mga may edad nag-exercise ng maayos, etc. Our expectation is mababa ang healthcare cost nila, right? And so what happens to that fee that can be used by the professionals? Ano bang guidelines natin doon? Kasi hindi naman ibabalik yun di ba? So they can actually use those fees for any health related program. They can implement that kung wala namang kailangan na pang bili ng gamot, kunyari may excess, pwedeng pangbayad yan ng, for example, gamitin lang pag open ng gym, pwede? Pag ano ng playground, pwede lang gamitin yon? Or are my questions the first of its kind that you've encountered?
Madam Chair, once the payment of PhilHealth right now is based on the performance of the facility, so for
Yeah.
instance, the local government unit, and based on the computation that money is performed by the facility, we gonna provide them the money. Then that money, once nasa kanila na, pwede nila gamitin for the consulta program, for the health program ng local government, Madam Chair.
No, so what did you mean? Sorry, can you repeat what you said in the beginning? What do they have to comply with for you to give them that money to begin with?
Madam Chair, under sa consulta regular, Madam Chair, consulta program that we have, we are registration first patient encounter. So the first patient encounter or the health profile, ito po yung binabayaran natin ng 40% of the 1.7. And the consulta services comprising of the consultation, laboratory, diagnostic, and medicina, ito po yung 60% of the 1.7 pesos. So initially, we are paying them the amount of money for the first patient encounter. Once they conducted that one,
you will pay for 60%?
40% po
40%
para
of the
sa
first encounter.
first patient encounter or health profile.
Okay.
And the 60% will be paid to them once they conducted the consulta services po, Madam Chair.
So they don't need to spend that money on the patient, that whole 1,700. It is a budget estimate of how much, di ba? That's an actuarial study, di ba? So you give, ang intindi ko kasi, correct me if I'm wrong, there's a certain population and you give what, 1,700 times the number of participants in the program. Is that correct? Am I wrong? Kasi yun ang intindi ko sa original consulte. Nagbago na ba?
Madam Chair, batay sa palisiya po natin ngayon, ang binabayaran po natin ay based sa first patient encounter po sa health profile. As this one is
Okay, so I think
performance-based din po.
Secretary, can I have your attention, please, no? My understanding, and this is, I don't know how many of you have been around, but I do know Secretary has been around. My original understanding of the Consulta package is that you have a specific location, let's say a specific city, your population, let's say, is 1 million, and you have a budget for that. Let's say you say the budget is 100 pesos. So 100 million, di ba? 100 million yon. And then hindi naman yung 1 million na residents magkakasakit. Hindi naman, di ba? Tapos kung 50% nun bata, mas malamang na magkakasakit doon yung mga nasa age 50, 60, 70 pataas, correct? So you do these actuarial studies to determine how much it takes to take care of that community. That was my understanding of
Correct,
Consulta.
Madam
Nagbago
Chair.
na pala.
No, that's the capitation payment. So what happens is each physician in a health center is allocated 20,000 persons in that population. So that 20,000,
That he is in charge. He or
he's
she
in
is
charge. Pag nag-patient sa Consulta package as implemented today, pag nag-first patient encounter, that means nagka-health profile na siya,
sa isang tao,
ibibigay-
sa isang patient.
or how many ang nagawa niya, pwede na sila mag-bill sa PhilHealth.
So kung
And PhilHealth will pay 40% of the 1.7.
100 patients.
Correct.
So 1,700, 40% of that ibibigay na sa kanya.
Based on
Okay.
the number of patients na
Na first encounter.
first
Okay.
encounter.
So sa 20,000 na na-assign sa kanya, and these are families, right?
Correct.
So I will assume
Persons and families.
possible sa isang family, wala. Possible na lahat, nagkasakit. Di natin alam, right? Oh, so there's an estimate, right? So let's just say in a year that doctors saw 10,000, right? Instead of 20. Kasi yung 10,000 healthy, hindi pumunta. So makakatanggap siya ng 40% of the 1.7 for the first year.
Yeah. Yung facility. The facility actually
The
gets that
facility
money.
that
The LGU.
doctor is-
The LGU,
is,
correct.
a part of.
Yeah, kasi yung doctor is paid for with a salary by the LGU. So the
Correct.
LGU gets additional money from PhilHealth for primary care services
Yung
rendered.
1.7,
Yung
40%. O then kailan makukuha ulit yung 60%?
Pag may laboratory, meron silang mga laboratory, no? Anong mga laboratory na ang accredited?
In the first encounter or the second? Sorry, I don't understand. I'm just trying to understand. The second encounter. So sa first encounter na may labs, hindi ko cover. I don't understand. What does that mean?
So sa first encounter, ano lang talaga, recording lang, history and PE lang.
So
And
it's
then
just for-
log in the computer.
you want the 20,000 to register in the
Yes,
first
yes.
encounter.
Para makuha mo na yung
Okay.
tranche kaagad ng 40%.
Ayos sa akin para maintindihan ko nga eh. Ako nga magbabudget niyan eh. Pwede ko din tanggalin yan. So be sure na naiintindihan ko yan. That is how I understood it to be. That is how I understood it to be. The way you explained it, medyo nalito ako. So tama yun. You want to capture everyone. So your enticement to capture all of them is I'm gonna give you 40% as soon as you register your 20,000. If they never come back because not a single one of them gets sick, then what? Then you don't get your 60%.
Ano, yun ang sagutin
So I
niyo.
don't know if that's a good incentive, di ba? Kasi paano ba? Of course, somebody will come back, of course. Yes.
Madam Chairperson, if I may. So, Madam Chairperson, as
You know, sorry, can I just say, what you need is a storyteller. You need a storyteller. That's what I'm asking. Nandun pa lang ako sa storytelling. Remember, I'm in charge of this budget. I did not know that you rolled it out. So tell me that story before you go into these details na hindi ko alam kung saan nahuhugot. Diba? I just want to know the story. I just want to understand that story. So you registered everybody. And then by registering, you get 40% just by registering. And then,
Madam Chairperson, please allow me to go back to the story, Madam Chairperson, as shown earlier by our beloved secretary. For example, an accredited rural health unit has one doctor. With that, Madam Chairperson, that RHU can accept as much as 20,000 patients. So that includes members and beneficiaries, includes all members of the family, as much as 20,000 pesos. So what we encourage, sorry, 20,000 persons, registered persons. So what we want, Madam Chairperson, the intention is for all these 20,000 to go to the primary care center or to do RHU
That I follow so far.
and to have their first
Record.
patient encounter or
Yes.
minimum health risk assessment.
Yes.
If they're okay, then no problem.
Yes.
So there's no need for laboratory, there's no
Yes.
need for medicine and
Yes.
additional services. So if all of them goes to the
So
RHU for the first patient encounter, then PhilHealth will pay the 40%.
40% of 1/7
1/7.
per person who registered. So kung 20,000, 20. Kung 15 lang ang na-capture. Okay. And then what?
That's correct, Madam Chairperson. So
then-
based on the health risk, minimum health risk assessment or the first patient encounter where checkup is usually done, if there's an indication that medicine should be prescribed and given to the
Yes.
patient or laboratory tests should be
Required.
conducted,
Yes.
then now the RHU can request for the payment of the other 60%
Okay.
of the 1,007, Madam Chairperson. So therefore, not everyone or not all of the
Okay.
20,000 will be paid the other 60% of the 1,700,
Okay.
Madam Chairperson, please.
Secretary, help me out understand this. My understanding was this is like an insurance system where the RHU and or the health worker will have that fund because it's possible that one person would have needs way beyond 1,700 pesos. And another person will never even bother to have any. So yung pag-assess lang naman, oras naman that's the valuable time of the doctor or kung may assistant siya, pero yun lang naman yung nilabas doon. So how does this work now that ang nire-reimburse lang is those who have actual need and it's now limited to 1/7? That is not the concept that I understood for years and years that this was being developed. Na iba yata.
May metrics naman yun, ma'am. But that's not entirely correct. Kasi may metrics. After the first patient encounter, you can still assess the LGU based on laboratories na pinagawa mo
Yes.
and medicines na prescribe mo.
Exceed ng 1/7 yung needs.
Hindi, hanggang 1/7 lang talaga ang baba. Yung above 1/7 is shared by the LGU na. Yun yung...
Here, am I the only person who was familiar with what this concept was supposed to be years ago?
Si Asek Albert is here to actually, who was with the benefit when it started.
Everybody here understands the concept of insurance? Not everybody gets sick. So yung binabayaran na premium and the premium is like the 1,700 na dapat tinatanggap yon nung health yung nung RHU. Tatanggap na yon para yung isang nagpalab na umabot ng 2,000 so kulang ng 300, makukuha niya ngayon yon dun sa healthy na inaalagaan niya. Let the record show that Dr. Albert is nodding his head. So how come no one can tell me this? Like I feel like I'm either dreaming, I'm either in another paradigm that none of you were present, but Dr. Albert is now nodding his head. So what happened?
Madam Chair, you are correct. It's a risk pooling.
Yes.
So not
There you
all,
go.
not
That is
all
the correct term, risk pooling.
risk pooling. Not all 20,000 individuals in our example are expected to undergo
sick.
laboratories. Not all will get NCD medicines. Not all will get infections.
Correct.
So
If the funding, how will it come in if you're only going to reimburse?
the 680 pesos, the first tranche, which is 40% of
It.
that will be the initial payment, regardless of a condition of the
Okay.
individual. And then the second tranche, which is the 60% of 1,700, will be paid based on a formula.
Actual need. That's
Not actual need, ma'am. Not
Okay.
actual need. So there is a table where, for example, all of the individuals who had the first patient encounter should have a consultation. It need not be an illness. It may be a wellness. That's one.
expense doon. Wala.
Wala po.
Some may not have, wala na. Kasi
Yes.
hanggang sa interview lang.
Yes, ma'am. And then that's the first one out of 4. The second one would be the number of individuals out of those with the first patient encounter who are tested for any laboratory test covered.
May lab expense.
Yes, pero 50% naman, parang scoring system, Madam Chair. So if one half of the 20,000, say 10,000 individuals
Did
get
labs.
laboratories, satisfied na yung condition na yun. That's the second one. The third one would be your non-communicable diseases, which should be somewhere around 15 or 20% of those who had the first patient encounter. And then the fourth one would be your communicable disease, antibiotics prescribed for 15 or 20% only of those 20,000. So as long as you're able to do all of those 4 conditions, you will get 100% of the second tranche at the January of the year after.
Individual who needed the lab.
That's correct,
So,
Madam
yung
Chair.
sinabi nyo, mali. Mali yung inexplain. Iba yung sinasabi mo. Tama ba? If you comply with that, then you can get the entire 60% for your population.
That is correct, Madam Chair.
So, yung yung how do you call it? Risk management?
Risk pooling.
Yung risk pooling is now in place because
Yes, Madam Chair.
this 20,000, there is a way to somehow estimate how many nga. Sabi mo nga, like 15% ang magkakaroon ng communicable disease. So, yung 1.7 na yon, hindi niya kaya lahat sila, kung lahat yan magkakaroon ng communicable disease, pero kaya niya yung 15%, di ba?
Yes, Madam
Tama.
Chair. When it was first costed.
So I said you have to be sure you have a good storyteller and not just telling a story, but telling it accurately. That's you. So anyway,
And then, ma'am, let me
para
add,
tayo nag-action ng time.
ma'am, that also adds to the initial opening statement, no? And it drives to performance. Kasi nga,
That's why
if
I waited
you're,
for my turn to ask because
Yeah.
it's consistent with my
Yes.
advocacy. I've been waiting patiently for that since 2004. Kaya nung sinabi niyo yung narinig ko na, babayaran lang yung nag-lab test, hindi. Puro abonado kayo noon, puro out pocket, puro yung mga kawawang kababayan natin at yung mga poor LGUs. Wala rin iaabono yung mga LGU na yun.
so if you keep your population healthy, exercise and all the other things,
exactly.
you will do less lab tests, you will prescribe less medicines,
Exactly.
but you will still be able to get the whole tranche of the capitation pay.
Exactly.
And then
why
you have
I-
money for building the health
Exactly.
center,
That's what
making it
I was
nicer.
asking. If there is in fact a savings, which would be wonderful, right? So either you have room to work with that fee because you're in the developmental stage or pilot stage, and at some point I remember one of the pilots 500 lang talaga. Kaya nga yung 600 mo, pasok na siya doon eh. Kahit nga wala nang idagdag doon, malaki ng tulong yung initial 40%, no? But that's why I wanted to see how could you also further reward them with more tools that support a healthy lifestyle and not medical intervention per se. Kung pwede. Kasi years from now, we will evolve and then we will be like, we did everything that you asked us to do. So pasok kami, covered. But, life isn't happy because we don't have any open space. Diba? The kids don't have any place to play. Kaya nga yung example ko, pati ba playground, pwedeng sagutin dyan. Diba? Because these kids develop their mobility,
Correct.
their big muscle groups when they have nice playgrounds.
So I saw this program in Abu Dhabi in a big medical conference. They do an initial assessment, which is our first patient encounter. So kung bata yon and they are obese, they are put in an exercise program and a diet program. So hindi mo siya i-hospitalize, but you are protecting that kid from non-communicable disease because they die of hypertension at 35 in Abu Dhabi. So yun yung health program. And we can implement something like that.
To get even more details so I can follow the program. Thank you so much, Dr. Albert, for your very short but accurate description of the program, which is how I understood it. Okay. May pahabol ka ba? Okay, gana. Okay. So what we will do, ladies and gentlemen, is we will suspend this hearing. Senator Bongo would like you to take time to comply with his requests. We have until October 11 to give you time to submit. That is Friday, I think. Is that Friday? That is Friday because we need to consolidate all your final requests and your compliance so that we can come up with our committee report to submit to the Health Committee. And then, Secretary, please take care of Nutrition Executive Director.
Madam Chair, she's arriving on October 10 and nag-message siya. And she will have a meeting with you. Our LLDO will arrange.
My first question is, how come nag-confirm siya sa inyo, nag-confirm siya sa
Wala
amin?
akong sagot doon. No.
Alamin mo. Dahil these are your people, so your budget is now hanging.
Or her claim on the text is that she couldn't book a flight because the flights were full.
Bakit siya confirm sa inyo? Bakit siya confirm sa akin? I'm fairly reasonable. If I already knew that ahead of time, I could have my staff would have told you na sinong USEC mo who can cover for that. But when we're not told, parang nakakaano naman, parang wala namang respeto sa hearing. And to think na alam niyo lahat, nutrition and preventive healthcare is my passion. Tapos mawawala siya dito. So anyway, but on that note, thank you to everybody else and kindly comply, no, so that we can make our everyone. Yeah, if you need to pick up anything or discuss with your staff, you still have like 2 minutes. We'll start. Settle in, please. Welcome everyone to the hearing of our subcommittee of the Committee on Finance. I'd like to greet all our resource persons, starting with Secretary of Health, Dr. Secretary Ted Herbosa, PhilHealth President and CEO Emmanuel Ledesma, our National Nutrition Council Executive Director Azucena Dayanghirang, PITAC Director General Maria Teresa